Okay, you call the Lane County Budget Committee meeting for Tuesday, May 12th, 2 to 5, in session. And first item on the agenda for me is to welcome all the staff that are here. I'm sure it was hard to get out on such a beautiful day, be in a nice warm building here. So thank you all for coming, and we look forward to most of you speaking. Okay, any committee business? Do we want to approve the minutes, or do we want next time?
I'll move that we approve the minutes as written.
Okay. Is there a second?
Second.
Okay, so moved and seconded to approve the minutes of Thursday, May 7th, 2 p.m. in this BCC conference room. Any additions or corrections? Okay, all those in favor signify by saying aye.
Aye.
Okay, minutes are approved. Any other committee business?
The answer to questions that was just handed out, I just thought I would briefly go through it. It's just one question that was posed about the debt repayment that's been mentioned in the proposed budget of both general fund and road fund. So the answer here shows you the bonds that are being paid off, what their maturity dates are, the amount of debt service, our current outstanding principal, what would be paid if we paid it as scheduled without early payment, and then what's being saved with the early payment, and we break it down by general fund and then by road fund. So if there's any further questions, we'll be glad to address that. Thursday, general expense, that's where that debt fund is located. We'll be talking about general expense, so we could address it then, or you could write a question if you had more detail.
Okay. Anything else? Okay, Alicia, are most of the folks here yours? Can you introduce them for us, and then you're welcome to
You
get
want me to
started?
come up to the table or you want me to do it here? Let me come up to the table because I have my notes with all their names. Is that okay, Dennis?
Yes, and transparency is very important.
I knew you were going to do that. In fact, I'd like you to note when I use the word transparency.
I can't see you, you're transparent.
You guys are killing me. All right, so first I want to introduce our assistant directors, Karen Gaffney and Lisa Nichols. From over here, Andrew Musicant from our Developmental Disability Services, and Ron Jelm, who is our division manager for our community health centers. In addition, he is still acting as the clinical financial services manager. And Jocelyn Warner, who is our new public health manager. John Aarons and Al Levine from Youth Services. You met Lisa. And Louise Colberg, who is our administration division manager. Not with us today. Steve Manila is in Chicago at a conference, and we have an acting behavioral health manager, Mary Jant, who isn't with us. Okay? Bruce, how did I meet you? You weren't sitting with the team. I'm sorry. Bruce Alvo, who is Trillium Behavioral Health. Sorry about that. Now I'll be turning my back to you for the rest of the day. Don't sit with the team. Dennis, are you ready for me to start?
Yes, sir.
Excellent.
Ma'am, sorry.
Don't call me sir. No, I work there. All right. So good afternoon, Chair Hinman and Budget Committee members. So I've introduced the staff, and I want to let you know about the presentation we've prepared for you today. We'll provide you information on the Health and Human Services Department, including our budget and some of the many services we provide to the community, and how our current strategic plan and proposed budget support the county's strategic plan. We'll also cover some successes and challenges and what we are looking for in the future. My plan is to read to you all of the... No, I will go quickly because I know some of you have been in another meeting, but it is a large department, so it's a rather large presentation. But we did time it, so we left about half the time for questions from the Budget Committee. So Health and Human Services is one of the largest departments at the county, providing a wide variety of services with 466 full-time equivalent staff across 9 divisions in 8 different locations in Eugene-Springfield area. As a department, we provide some traditional health services, both to individuals and to the larger community, through our community health centers and clinics, behavioral health services, and public health. We also provide a range of traditional human services, and through our developmental disabilities and human services division, and through our youth services division, which also includes juvenile detention. Trillium Behavioral Health is part of a joint venture with Trillium, our local coordinated care organization, where the county staff are housed at with Trillium staff, and we manage the mental health and addiction benefits provided to local residents on the Oregon Health Plan. Finally, our clinical financial services and administration divisions provide the critical infrastructure to support all those other divisions that are providing services to people in our community. This slide is a breakdown of the department revenue by source. As you can see, the largest portion of the department, almost $114 million budget, is the 51% or $59 million received from federal grants or reimbursements. Our other category includes fund balance, donations, various non-federal reimbursements, and the department's administration allocation. Makes up 25% or $28 million. The general fund portion of the department is 9% or about $10 million. Here's a slide of how the general fund is divided. The largest share of the department's $10 million general fund is allocated as follows: $6.7 million to youth services, $2 million to public health, and $900,000 to human services. You'll hear more about these programs as we move forward through the presentation. This is a visual overview of Health and Human Services Strategic Plan, starting with our department mission, which is to promote and protect health and well-being of individuals, families, and our communities. Some of you may be familiar with the concept of the Triple Aim. That is part of the National Healthcare Transformation Movement, but really applies across our health and human services work. In order to be successful, we need to simultaneously improve the quality of care, of service that we deliver, reduce or contain costs, and improve all overall health outcomes. And when we refer to health in health and human services, we mean that is in the broadest sense: physical and behavioral health of individuals, but also economic well-being, decreased criminality, and all other attributes we think of when we imagine healthy communities. Our strategic focus is built on 4 pillars of success: ensuring equitable and timely access to services, a focus on integrated care and prevention, leveraging and leading with quality analytics, and developing quality outcomes through efficiency and staff development. Those are the principles on which our outcomes and strategies are built. Finally, we identify 3 key outcomes that cut across all of health and human services. As you know, we had a wide variety of services and requirements. However, as a department, we expect that everyone can and will contribute to achieving these 3 outcomes. First, reduce smoking. Second, reduce adverse childhood experiences, and improve financial sustainability. We picked these because they are such huge drivers in our efforts to obtain the Triple Aim. Tobacco is not only the leading cause of preventable death, but it creates huge monetary health and other costs across our community. It's a similar story for adverse childhood experience. The early traumatic experience, such as child abuse or having an incarcerated parent, that research has clearly demonstrated impacts physical and behavioral health throughout the lifespan. Finally, the importance of the 3rd priority should be fairly obvious. Financial sustainability is core to our work and our ability to continue our work. In other words, no money, no mission. Hopefully this looks familiar to you. This is the county strategic plan with the 3 areas of focus: safe and healthy county, vibrant communities, and infrastructure. We've been asked to talk about how Health and Human Services and our proposed budget help support the work of the county strategic plan. So in this version, we've inserted into the county overview some specific initiatives from Health and Human Services. We put them in the 3 focus areas where they apply. Since this version's font is way smaller than I can read, and I'm not sure if I'm seeing anybody out there being able to read it, we've done some individual slides where we've pulled out the the categories and put in the work of Health and Human Services that Health and Human Services is doing. So the first one, Health and Human Services plays a key role to ensuring safety in our local community. Due to the public safety levy generously passed by Lane County voters, our Youth Services Division has been able to open and maintain an additional 8 beds of custody, as well as 8 secure intensive residential treatment beds. The levy has also allowed for the expansion of intake to 24 hours per day, 7 days a week, which increases our ability to respond to police activity and allows more thorough follow-through on reports of crime. The Behavioral Health Division is also a significant driver in community safety. Over the past year, Behavioral Health has entered into several collaborations with our local law enforcement partners, focusing on those individuals that intersect both of our systems. Through the newly established jail diversion program, behavioral health staff are working with law enforcement and court staff within the jail to divert those with mental health illness from the jail and into behavioral health treatment. Additionally, behavioral health is coordinating with criminal justice, court personnel, and other mental health service providers to identify gaps and needs related to those individuals who cross both the behavioral health and the criminal justice system. Work is in progress to prioritize the needs and establish both short and long-term solutions to ensure that appropriate, cost-effective behavioral care is available. Lane County Behavioral Health also continues to work with local law enforcement, providing crisis intervention training to assist with the employment of effective measures and standards for law enforcement personnel dealing with individuals experiencing mental health crisis. Both behavioral health and youth service have a long history of investing in evidence-based practices, those strategies that research tells us will provide the most effective treatment, thus help us maintain safe communities. The county's second objective identifies implementing the Community Health Plan, or the CHIP, and this is also a core driver in Health and Human Services. We work closely with Peace Health, Trillium CCO, United Way, and others on those 5 priorities. Tobacco, obesity, substance abuse, and mental health are all fairly well self-explanatory. In the area of health equity, we work on addressing the conditions in the community that result in people in some populations having worse health outcomes just because of their gender, race, or socioeconomic status. The priority of access to care includes basic access to primary care provider, but also things like access to dental care, immunizations, and other critical services. The work on these priorities cut across all the divisions in Health and Human Services. The slide shows the 5 specific strategies the Board of Commissioners identified as their priorities, and the staff at Health and Human Services continue to work on those priorities. Our staff in Public Health launched a county tobacco retail licensing program in the current year and hope to work with the cities next year to spread that program into other jurisdictions. The strategy to promote local food and vegetables not only addresses childhood obesity by working with programs like Farm to School, but it also is a way for us to partner with county economic development and intergovernmental relations staff. We talked earlier about our work with Adverse Childhood Experiences, or ACEs, and the strategy regarding behavioral health is targeting populations such as those who are involved in the correction system, with which we just talked, or who are homeless. The focus of our work with the Human Service Division, as well as Behavioral Health and Trillium Health. Finally, the last bullet is pretty self-explanatory. There is a significant unmet need for primary care as well as specialty care in the rural communities, and we are working with existing partners on funding technology solutions to try to address those needs. The focus of partnerships in the county strategic plan is also critical in the way Health and Human Services does its work. A few examples are listed on this slide. The first 2 bullets on this list were mentioned during the creation of the county strategic plan and our key partnerships. Our Human Service Division provides staff support to the Poverty and Homelessness Board, and I believe a couple of you, at least one of you, are on that board, right? Our Human Service, they bring together representatives from the county, city, private nonprofits, philanthropy, and clients from other community leaders to design and implement strategies to address poverty and homelessness in our community. The Trillium Partnership refers to our work with our local coordinated care organization as the public part of the public-private partnership. In this collaboration, we work with providers, clients, patients, and community partners across physical and behavioral and dental health. We provide staff in public health prevention and Trillium behavioral health, and we'll bill for services through our community health centers, behavioral health, and public health clinics. And we are now working with them on our second new clinic second clinic in 2 years, where Trillium is providing the startup funds to enable us to expand more primary care. In developmental disabilities program, the new adoption of the K plan serves to create partnerships between providers and the served individuals and families with the goal of increasing access to community support and assisting people to maintain a life in the community rather than in higher levels of care. An example includes our work to contain the spread of communicable disease and our work to improve services to veterans. In both of these cases, we do our best work when we are part of a larger system of service and support. Our staff work closely with other providers in the community to assess needs and help make sure that individuals are matched with the best service to meet those needs. And we work to make sure that the larger system is supported across our community. HNHS also works to support the county's second area of focus on vibrant communities. The first object is to invest in a strong regional economy. A key way that Health and Human Services directly supports this objective is our workforce program that became part of Health and Human Services last July. A team of 15 staff works with the State Employment Department and the Department of Human Services to train, coach, and connect people who are unemployed with opportunities to gain and retain meaningful employment. We also work with local businesses to create a variety of funded on-the-job training opportunities that are wins for both the business and the employee. Another example we talked about earlier was our work with the CHIP, or the Community Health Improvement Plan. Staff in public health are working with county economic development staff to promote local fruits and vegetables. While this is certainly a strategy to support health, it's also a solid effort to boost the local agricultural and improve ways and ease in which local produce makes its way to local schools, kitchens, and low-income people in our community. Again, this is a win-win strategy for our community. Finally, the work of the department directed to improving the health of the community helps to support an environment that is more attractive to employers. When people are healthier, they're more productive employees, and health insurance costs are better contained. HNHS continues to support and protect our natural environment in multiple ways. Our Youth Services Division contracts with the Forest Service. They contract with the City of Eugene and other partners to build trails, clear vegetation, and complete other projects such as stream restoration. The benefit of these services is twofold. Not only are we contributing to continued beautification of our natural resources, but these activities also promote hands-on skill training for our young people. The opportunity allows them to practice the skills learned in the classroom and promote a sense of pride and ownership in their environment. Research tells us that individuals are less likely to participate in damaging our resource in our community when they feel connected to it. Additionally, our public health staff contributes to this objective, particularly through our environmental health program. Staff work with small drinking water systems throughout the county to ensure ongoing safe water and are often called in to collaborate when the State Department of Environmental Quality is concerned about a local health hazard. A recent example includes a large tire dump that was creating a potential health hazard for a community. Whenever we regularly work with a variety of code enforcement agencies with regard to illegal dumping. We also regularly work with the Oregon Health Authority and the Army Corps of Engineers and the Forest Service on issues such as monitoring our local waterways for an annual algae bloom that poses a risk to not only people but to pets. Here you go, Dennis, just for you. To ensure transparency and community engagement with our work, HNHS utilizes a number of citizen advisory committees. This slide lists the official board-appointed advisory committees with which we work, which is just a slice of the community coalitions active with Health and Human Services. The Community Health Centers Advisory Committee includes community members and patient representatives who help steer the work of the CHC to ensure that we are responsive to the needs of people who have traditionally been medically underserved. The Mental Health Advisory Local Alcohol and Drug Planning Committee is composed of memberships that broadly represent our community, including consumer representatives and serves to advise the local mental health authority on community needs and priorities for the mental health, developmental disability, drug and alcohol, problem gambling, and offender services. The Human Service Commission is our intergovernmental effort with the City of Eugene and Springfield to leverage our strengths to support a strong, coordinated human service in our community. We also utilize the Juvenile Justice Committee, which falls under the Public Safety Coordinating Council and holds the charge of advising and oversight of the juvenile justice system. I spoke earlier about the Poverty and Homelessness Board and the great work they are doing. Finally, we also work closely with the Public Health Advisory Committee, where the focus is on the needs and priorities of the overall health of the community. This year, we've studied a number of issues and made formal recommendations to the board and department related to regulating e-cigarettes and related to the state implementation of the new retail marijuana measures. These committees provide us opportunities for community engagement and transparency in our work. The other part of the objective is to focus on equity. In Health and Human Services, we are doing internal work with our employees as well as work in large community to support equity. Health and Human Services has a standing equity committee that brings together all of our divisions to address how to improve our efforts in equity as an employer as well as a service provider and funder. As a department, for years, we have required that all our employees are to complete at least 3 hours of training each year in the area related to equity and cultural competence. This supports the ongoing atmosphere of working together to continually address these important issues. In Health and Human Services, we have many talented staff, and I'd like to share one example that is relevant here. Lucy Zamarelli is one of our supervisors at Trillium Behavioral Health, and she's also a member of our HNHS Equity Committee. Her expertise in this area resulted in her appointment by Terry Copeland as the Health Equity Officer for all of Trillium, providing leadership in the area of equity and inclusion for the larger health delivery system. Additionally, to honor our commitment to equity, our Youth Services Division has engaged in work centered on disproportionate minority contacts. The effort includes multiple components, including a partnership with the U of O to analyze implicit bias and implement systems to reduce that impact. The DMC work also includes the use of decision-making tools, such as the Juvenile Crime Prevention Risk Assessment Instrument and other data collection measures. This captured information is being utilized to develop systems and protocols that affect the critical decision points and is widely shared with our partners and used in educational activities throughout our community. The third area of focus in the county plan is around infrastructure, and Health and Human Services also has programs that support this larger work. The first objectives include county facilities as well as parks and other infrastructures to support Lane County as a destination for visitors and residents. As I said earlier, Health and Human Services programs are currently delivered in 8 different buildings, and efforts are underway right now to open an additional CHC, although that will be in a leased facility. We're currently working with staff in county facilities to ensure proper management and maintenance of these buildings and grounds. Another example of HNHS work towards this objective is the work in our public health, environmental health staff do every day to inspect and license restaurants, pools, spas, and other facilities that serve the public to make Lane County an attractive place to live, work, and play. Often this work is invisible. However, these staff are critical to ensuring the safety of restaurants and other facilities so that most of us don't worry about when we use these services. The support of a strong internal administration infrastructure, HNHS strives to utilize data and analytics in our operational and strategic decision-making. As one of the 4 key pillars, it supports our mission. Health and Human Services is committed to leveraging data and utilizing this information to develop and meet quality outcome measures for individuals and systems that we serve. Another eye test. In fiscal year 15-16, 21%, or 24 million of the 114 million budget was subcontracted. To give you a visual of the volume of contracts, we have listed, included the listing of 319 organizations or individuals who hold more than one of the 630 active contracts. Go slow so I can get the drink.
That only goes to
Good job.
Now, Steve, you know why you get so many contracts from us coming across your desk. The Department of Health and Human Services has large-scale changes on the horizon. Behavioral Health Services is currently in development of a new service delivery model that embraces the concepts of wellness and recovery. The model utilizes enhanced evidence-based recovery-oriented methods to ensure that individuals are receiving the right level of care at the right time. Developmental Disabilities is in the process of implementing the K-Plan, which represents a shift in services with a larger focus on services that are community-based. Along with this change, a workload model has been developed and, if funded, would allow developmental disabilities to add approximately 10 to 15 full-time equivalents to reduce caseloads and service activities and service level activities. One change in the larger environment that impacts most of the divisions in Health and Human Services is the impact of the Affordable Care Act. Tens of thousands of Lane County residents who had no health insurance in 2013 are now insured through the combination of Medicaid expansion and the rollout of the insurance exchange. Fewer than 5% Oregonians are now uninsured, which means that those healthcare delivery services in Health and Human Services are now able to bill or for fees or insurance reimbursements for many of the services. And many of the clients have expanded access to services. Related to this change in our environment is the significant increase in demand for primary care services. Now that people are insured, they are seeking medical services, and we do not have services to meet that demand. We talked earlier about our partnership with Trillium and the opening of the new site as a way to deal with this. We also have changes on the horizon in public health, many of which are still to be determined by the legislative process. There is a statewide push to modernize our public health systems, which we hope will ultimately result in improved resources for these important services. This slide gives you an example of recent successes. In July, we integrated the direct part of Workforce Partnership into Health and Human Services as part of the Human Service Division, resulting in new opportunities for collaboration and improved services to individuals and businesses in our community. In August, we opened our 5th community health center site, the Brookside Clinic at Chambers and 17th, providing access to more than 6,000 Oregon Health Plan members. Additionally, recent successes for Trillium Behavioral Health include the expansion of the assertive community treatment services, which provide invaluable outreach, support, and housing to services for persistently mentally ill population. Youth Services has also realized their success in securing Title IV-E federal funds. These monies enable broader financial support for their services and allow us to sustain the current level of programming as we move forward. I also want to call out the work of Public Health Communicable Disease Team. The team has been managing a parade of outbreaks in our community, ranging from meningitis B to pertussis, from chickenpox to tuberculosis, from measles to hepatitis, and lots in between, including a host of sexually transmitted diseases. Many of our partners are surprised to learn that our CD team has only 4 nurses assigned to the investigation of any outbreak for a county the size of the state of Connecticut. I won't say that. She's on vacation now. That's where she was. Thanks a lot. We use some of these fundings from the state to expand our outreach program for veterans, helping make sure, hey, ready, Joby? Say the warning. Helping make sure that returning vets, particularly those in higher education, know about and can access the services and benefits to which they are entitled. I want to pause for a moment and invite our Veteran Service Coordinator, Joby Riley, to come on up to the table. We didn't leave him a chair.
So he's there you go.
Thank you. We were not prepared. Joby shared a story with you last year about one of our clients in Veteran Services, and last year's story has continued to unfold. So we invited Joby here to, as Paul Harvey would say, for you to hear the rest of the story. Toby?
Thank you, and thank you, committee. So over the last 4 quarters, we've helped nearly 1,000 veterans and surviving spouses obtain positive decisions from the VA. Those decisions resulted in nearly $900,000 in monthly continuing benefits and $8.2 million in lump sum retroactive benefits. Some of the retroactive benefits were quite large. Nearly 50 were greater than $35,000, 4 were over $100,000, and 3 were over $200,000. And I'm happy to report that one of these large retroactive awards was for a gentleman I discussed at our last meeting last year. I believe I called him Tim. As you'll recall, the Veteran Service Office staff worked with his mortgage company and the VA in Portland to help him avoid foreclosure. He lived with his mom, who was just on Social Security. He was just on Social Security himself. And at the end of my lengthy recitation last year, I mentioned that we were still prosecuting his claim. He'd filed originally in 2004, but the VA only awarded benefits back to 2009. A couple of months ago, we finally got a decision on that intervening period, and he was awarded benefits at the 100% level back to 2004 and received a VA check for $225,000. So thank you for your long-standing support for a Veteran Services Program. Only through your efforts and backing are we able to do the work that can make such a substantial difference in the lives of our clients. Thank you.
That's great. Now I'm going to follow with critical services. Okay, here we go. Significant constraints. We were asked to address the issue of constraints going into the next year, and we definitely have some of those. The first issue is our ability to recruit the particular types of staff we need to deliver our specific services to the community. For instance, in order to deliver our clinical services, we need physicians, nurse practitioners, nurses, licensed mental health providers, and medical assistants. And these people are also in very high demand for other employers. We can't operate our services without them, so we are not only working closely with our HR department, but for some of these classifications, we've actually hired outside recruiting firms and deployed all types of creative strategies to try to attract qualified applicants and then to retain them in an environment where we compete with both the private and public sector. We also have had some resource constraints. Costs continue to climb, and customers' needs and demand is increasing across most of our services and divisions. In our family mediation program, we are facing significant staff reductions as a result of changes in the way the revenue is split. We talked about the needs of the poverty and homelessness area, and many of those solutions, like available, affordable housing, require significant cash investments. Also in the resource category is time constraints, which can also be seen in staff time to help people to help solve their problems. Finally, I'd say we have sometimes constraints in the area of strategic bandwidth. The scope of issues in health and human services is huge, with lots of needs and lots of opportunities. In order to effectively prioritize the needs and opportunities to work with community partners to devise solutions, and then to leverage the necessary resources to make system change demands a certain amount of strategic bandwidth among the department managers and leaders. We are often operating on the edge of our limits in that area. Here are a few big initiatives facing us next year. Some of them we've already talked about, like the work to open a new CHC primary care clinic. And we continue to focus significant efforts on better integrating primary care and behavioral health services. And we know it helps us get at the triple aim of better care, better health, and reduced costs. We also have some technology initiatives. The CHC has recently received a telemedicine grant that will broaden service outreach, both with behavioral health and work in the rural areas. The first steps with this work will be to further internal integration between the CHC and behavioral health, allowing for consultation between our primary care and mental health providers. Our DD division is also in the process of implementing a new electronic health record. This technology will increase efficiency, including improved data tracking and reporting. And we continue to enhance our electronic health records with the community health centers. Finally, next year, we'll be working with our community partners on the new Community Health Needs Assessment and the Community Health Improvement Plan. In H&HS, the triple aim really serves as our North Star. It's the filter through which we make our strategic decisions. These actions help us move the needle on these three things. Again, with health being that broad definition of well-being that drives all of Health and Human Services. And to the extent that Health and Human Services can push towards the triple aim, we are helping the county reach its vision of being recognized as the best county to live, work, and play. Now it's your turn for questions. Turn it back to the chair.
Questions?
Great presentation. Thank you very much. Obviously, a lot of work went into it. So 2 questions. Is the new clinic that was in the paper at the old Parties to Go location, is that included in this proposed budget?
No.
Some of the FTEs, I believe, are included in there that we've had to create now to be able to begin recruitment efforts.
Okay.
But I'm looking at
We
Lenny.
haven't put the rental or the other expenses in there yet.
Are you expecting a significant impact in this proposed budget?
After this proposed budget, yes.
Yes, but you won't have will there be a big cash impact in addition to what we see here?
So I would expect that by the time technical rolls around, we'll have a better sense of timing in terms of when those expenses will begin. But I think the article in the paper indicated we haven't signed a lease yet. So hopefully by June, we'll know exactly when those lease payments will start. And so I would expect that we'll be able to add those revenue and expenses in before budget adoption. But back in January, when we were prepared to propose, we didn't have.
Right, it seemed like that timing spoke it up. I was wondering about that. And then one more quick question. In your budget, you referenced that there will be an increase in fees generated through client services. Is that the ACA reimbursements now you're able to bill for some of those services, or are the prices going up, what we charge?
I'll let you do that.
It's absolutely because people have insurance benefits.
There's somebody to bill now.
Sometimes we have marginal increases that the board agrees to in fees based on costs going up, but those really have been pretty small. So it's mostly the fact that we're able to get higher reimbursements, and particularly for those parts of our services that are included within the community health centers, we're able to get a higher Medicaid reimbursement rate for people who have Medicaid. So because that population is increased, it increases our revenue as well.
Great, I wasn't sure if it was a volume or price or both. So, great.
Anything
Thank
else,
you.
Ron?
Yeah.
We have our finance guy for this.
Yes.
And our,
I have just one question. If you could talk a little bit more about the public health modernization. I know it's not going to impact this year, but I'm just curious a little bit about, is that something, using your crystal ball, that you see action on this session? And then you talk about that it'll have impact in future years. Is that on the revenue side, I'm hoping? Is that about reallocation of how state public health dollars will affect county public health departments? Or can you just talk a little bit more about public health
Thanks for the
modernization?
question. Really appreciate it. And I'm going to actually ask Jocelyn to come up, and she can start, and Karen's there for you. So come on up. She's like, really? You just...
Yeah, why don't you go in county?
Yeah. It's best when we come up here.
There's really a lot that's unknown at this point. I'm sure a lot of you are familiar with what's going on in the legislature with the future of public health. It's being reorganized at the state level and also at the county level to to coincide as well with the way that we've transformed Medicaid in the state as well. But right now it's still in the Ways and Means Committee, and there's still a lot to decide. There hadn't been a lot of funding specified in the original bill. So CLO and some others worked together with the committee in order to improve that piece, add some potential funding streams, and also improve the language around what would be required of local public health, so that it wasn't requiring a lot of essential public health services without the funding to match that as well. So we're still kind of in a holding pattern, waiting for what's going to happen. We really don't know yet. But Chloe and a lot of the county partners, and Karen has also worked with them to try to create a bill that will really help us facilitate delivering all those essential public health services and coordinate as well our services with the CCOs in the state better.
Is that good, Laura?
The name of working on.
Yes.
Yeah, more to come.
Thank you, John.
So a question on you, because we've had these discussions quite a bit even in the Board of Health, and that is the open positions, the positions you're trying to recruit for. So those open positions, are those already budgeted? So your physicians, your physician assistants, nurse practitioners, are those already budgeted positions that you're trying to recruit? Is that correct?
Correct.
So the other piece then is, I think it was about 2 years ago, there was this potential where Douglas County may have said, we're out of the public health business altogether. Obviously, some things came together from the state side, but as we know, our assessor actually, there's been this group that's formed, the assessors group with several counties now. And listening to our commissioners, say from Curry County, Josephine, and now Douglas, Curry County's already off the cliff. They just haven't hit the bottom yet. And Josephine's right behind them, and now Douglas is about to fall. Are we potentially in a position where if the state were to come in and say, you know what, we can't handle this public health from these different counties, can Lane County then partner with these counties to take up some of that slack? Are we in the position to maybe look at that in the future, or do we need these positions filled first? What's your kind of general assessment here? Because I have a funny feeling that that's something that may be coming down the line here before we know it. So hard to look into the crystal ball completely, but that's a potential. Is there maybe some general thoughts on that?
So I'll take a stab at it, and then Karen and Jocelyn, please feel free to take it. So when this did happen, Commissioner, we did look at what could we possibly do and how would it affect the work we do in our community. So it's something we've been aware of, we've had conversations with, we've had conversations not only locally but with state partners, and so could we? There are things we certainly could. How would it affect then the services Lane County would be something we were going to look at to make sure we aren't, putting extra burden on our community to take care of another community. And you can see we only have 4 CD nurses right now, and so how would that play? And if you go back to one of the first slides, you'll see that we get quite a bit of general fund in public health. So then how would Douglas County be able to support that? And we wouldn't want to be taking Lane County residents money to support Douglas County. Well, maybe we would, but that would be your decision.
No, I think there would have to be a general, some sort of agreement, partnership, either with the state and even potentially with the counties as well. I bring this up because, one of the things I've learned as we've had meetings in Salem and with other counties is that our public health is as good as any in the state of Oregon, and I'm really proud of that. And it's always fun to talk about how good we do in the leadership of all of you. You really deserve a huge round of credit, because I get to hear this from other commissioners statewide about how well we do. And I think we learned that with the whole CCO and how we were able to move forward and not only move forward but come out quickly but also very effectively. And that's why I bring this up, because I think, what people see, they look at success and think about how can we work through this and maybe where other counties, because I don't know if these other counties are going to be able to provide these services, these delivery of services. They're beginning to really wane and cause significant issues with especially these smaller counties. And that's why I asked the question. And while it's potentially a future budget item, I think what was important to me today was just to find out if those positions we're recruiting for are already budgeted. And because I think that's important, because we are competing, by the way, against the hospitals. And one last question, if I could, and that is, you talk about PCell, Trillium. Have you engaged with McKinsey Land as much? And the reason why I ask that is because, let's face it, they are they're a part of the largest for-profit hospital chain in the United States, based in Tennessee, which I got to know those guys okay over the years too. So that's why I'd like to know if we're engaged with them, because I think they have a lot to offer as well. And not to take anything, obviously, from PCell and Trillium.
So Yes, we absolutely are engaged with McKinsey Willamette. Part of the reason when we talk about the Community Health Improvement Plan that Peace Health is mentioned there is they are required to do a community health assessment because they're a not-for-profit hospital, which McKinsey Willamette isn't required to do, so they don't get lumped in as a primary partner on that particular project. But from the very beginning, for instance, of Trillium, McKinsey Willamette has had a seat on that board, and we've worked closely with them in all of that work. And I'm looking at Ron over your shoulder. Our very first community health center, Riverstone in Springfield, was right next door to McKinsey Willamette, and we've worked closely with them on that project, too.
It outgrew itself really quickly. I remember it.
And I do like the new clinic. Now everybody refers to it as a party-to-go clinic.
That's right.
I'm not really sure we're going to brand it that way.
And Commissioner Liken, if I could add one other thing about the discussion around Douglas County, it's interesting. Our work with Trillium gives us an opportunity to begin to explore that a little bit more, too. Effective May 1st, Trillium's service area has expanded beyond just Lane County to now include the Umpqua Hospital District or Health District in Reedsport. Thank you. I was coming up with Roseburg, and that wasn't right. In Reedsport and Elton and that surrounding area. So we'll have an opportunity to begin exploring what does it mean to do things outside of our county.
Thank you, and great job to all of you. I really mean that. It's always fun to hear other counties throughout the state talk about Lane County Public Health. It's fantastic, so really appreciate it.
Thank you. So, spending some time yesterday in the Public Safety Coordinating Council budget meeting, and then, today we had an item on our agenda relative to some possible industrial development. One of the major things that you're aiming to do is to reduce adverse childhood experiences. And a lot of those are driven outside of your department somewhat. Could you speak a little bit to where you think the most benefit to your department as far as reducing your, the incoming, so to speak, the in-basket side of your job would be helpful, as you look at the overall picture of our services and where maybe we as a board and budget committee should be lobbying for changes and all that. I look at our Community Corrections Act funding, and at the high end estimate, it's only a 1.4% increase. At the low end, it's a 7.5% decrease in funding. Those guys are supervising, our offenders, conviction offenders, including sexual assault and domestic violence folks, which that's, tied directly to adverse childhood experiences. A lot of the ACEs are related to poverty, and we're talking about trying to increase employment with the lands in Goshen. Where do you see we ought to be thinking outside of the health and human services to try and deal with that inflow of people needing services to you guys versus trying to treat them once they're there?
Want to give it a shot?
Sure, I'll start, and then there may be people along the edges, too, who want to chime in. If I'm looking at our inflow from outside of our particular department, when you mentioned community corrections, the first thing that came to my mind was earlier this week, Kathleen Brenner, who's our supervisor in family mediation, which has also developed programs specifically around adverse childhood experiences, is meeting with parole and probation to talk about what can we do for parenting education resources for people who are under supervision, because so many of those offenders are parents. And many of you know we had an all-staff meeting with our group last fall that specifically focused on the research around adverse childhood experiences, and the message we were given was to interrupt the intergenerational aspect of those ACEs. So what can we do to really build resilience among children so that then they are less likely to need some of our high-end services. So I think about our work with our corrections partners, the work that behavioral health is doing with the jail, I think makes a huge difference. The prevention work that we're doing in new services with kids and families there are some of the ways that I think not only stem the tide for our behavioral health services, but as the research shows, for our physical health services, too.
I don't know, people can.
Actually, I was just going to chime in and say, just the fact, Commissioner, that you picked off a few things is wonderful. I mean, because you are looking outside of Health and Human Services, you are looking at that economic piece, you're looking at that prevention of child abuse and prevention of sex abuse, and that impact to our community and our kids and as they become adults in this community. So I appreciate that, and just sitting and thinking about it now. Thank you. Does anybody else have anything to
I
say?
know, I just caught Bruce out of the corner of my eye, and you're doing a lot of work around our system of care.
I was just going to say that we have a system of care executive committee that's got the leadership of different governmental agencies, schools, DHS, Al and Karen are on it, and Karen has done just a marvelous job of talking up ACEs and resiliency and getting that committee to commit that will be one of our focuses for the next year or 2 years in terms of trying to get all of our organizations working together.
I was just going to add, this is exactly what in the Community Health Improvement Plan, the entire whole piece around health, I mean, that's what health equity, that's what the whole section on equity is about, on health equity, and if you reread the sections on that and applying the health equity lens to all of the components of the Community Health Improvement Plan, and then to all of the other departments, all the other presentations we're hearing about, that's exactly what we'll get at, just what you're talking about, and that's really what's required. And I'm really curious. I know it's outside the specific scope of the Budget Committee, but I'm personally really interested in hearing more about the Health Equity Advisory Committee that CHIP talks about creating, what their recommendations are about how to apply that health equity lens to the Community Health Improvement Plan to get at exactly what Commissioner Boza was just talking about. That's exactly what's required to get to those upstream solutions.
Al, did you have something?
I was just going to mention.
Do you want to come up here? It's just...
Youth Services has been engaged with the folks from Georgetown University in a project called the Crossover Youth Practice Model. And Crossover Youth are youth who've been involved in the DHS child welfare system and then are beginning to cross over into the juvenile justice system. These are the very kids we're talking about who've had lots of trauma and adverse experiences in their lives. As part of that, the prevention folks from public health have been very active in this process, and they've developed a whole prevention look to look at the siblings of the youth, the younger siblings of the youth who begin to enter the juvenile justice system, and what kind of services can we wrap around that family and those younger siblings so that we can sort of remediate the effects of their adverse experiences before they get to the point of being removed from the home by child welfare or enter the juvenile justice system.
Seems, having been around the juvenile justice and criminal justice systems for almost 40 years, that the more things change, the more things stay the same. And I've heard a lot of words that are new, but the theories, dysfunctional families, breaking the cycle, they're still here. As much as we study them, they're still here.
Thank you. I don't have any questions, just a couple of comments. You know, I happened to serve for the last couple of years on the NATO, National Association of Counties Health Steering Committee. And a couple of things that Commissioner Lycan said, really, I can echo based upon what I've seen and heard nationally, not just in Oregon, regarding the quality of the work that you all do in this county. You know, clearly, we are a model for other counties in the state, both in the way you implement the budget, the way you address services, and the way you coordinate with the CCO. I happen to be back in Washington, D.C. at the legislative conference, and talking about outbreaks. And we just happened that very day to be making headlines on outbreaks. And the word about how Lane County was handling that went ahead of you. In fact, the person from the CDC that I was talking to had already heard what was going on here. And, you know, and I raised my hand to talk about, Roy Lane County we have, and she finished my sentence. And it really, it really tells me a lot about how much you guys are doing. I really stand in awe of when other commissioners and I go to Association of Oregon County meetings, AOC meetings, we find out that really that's when we truly see how good of a job that you're doing. And when you look at how many people are being signed up on the health plan, and the number that is diminishing of people who don't have access to health care in Lane County, it really is a tremendous thing. And it's easy to not really recognize that when we sit here in Lane County, but actually go abroad and see how we're doing compared to Kansas and Mississippi and Wisconsin.
Had to do it, didn't you?
It just is remarkable the job that you do. One of the things that I personally attribute it to is when I first came on board as a commissioner, is when you were beginning to implement the community health improvement program and the CHIP. And I don't know that anybody else has anything as well defined and as well established and as well adhered to throughout the department as you all have for the CHIP. And when we came up with that strategic plan, Steve and I were talking about the CHIP and how well defined and well programmed it was, and it fits perfectly into our Lane County strategic plan. It really is an asset of the community. It makes it really easy for me to answer questions, because all I have to do is go back to the CHIP and say, well, they say, well, what are you doing about that? So, well, let's see, prevent, reduce tobacco use. Let me list the ways. Prevent, reduce obesity, prevent and reduce obesity. Let me count the ways. You guys, you have your strategies, you have your tactics, and you list them and you check them off one by one. And even though we are short of professional staff, always looking for new professional staff, it really is, it's remarkable the work that you do. And it's, once again, I attribute it to the fact that you have it all documented, you have it all listed. I do believe that I could go to any single employee in any one of those areas and ask them, what are you doing that right now, at this moment in time, that pertains to the CHIP? And they'd be able to tell me specifically how their work relates to the CHIP. That's how you make things work, and that's how you get the pinnacle of service that you guys are now. And I really want to thank you for making my job a lot easier. It really makes it simple for me to respond to the emergencies that come up and respond to the needs of the community.
Thank you. I'm just going to take a second and appreciate the fact that, thank you, Commissioners, for saying that we have a good reputation throughout the state. I have to say, speaking of jealous, we have plenty of people that do our work throughout the state that are jealous of our board. And I'm not just saying that because I want you to find it, but as the Board of Health and the Board of County Commissioners, the level of which you can speak about this is outstanding, and people hear about it and really have shared with us they're happy for us that we have that.
Anything else? I'd like to move on because we have a contingent of sheriff's office. Is there something that can't be put on the card?
No, it can't.
Okay.
Actually, it probably could. No, but it goes back to the professional staff and the budgeting on the professional staff. So when you're competing against the non-profit private sector or the for-profit private sector, they can offer signing bonuses. Can a public agency offer signing bonuses?
Depends. You want to take that?
Well, I was going to say we don't, but I don't know that we couldn't.
Let me tell you the level of which we're recruiting. Needed my car battery jumped. The woman came to jump it. She's talking about her friend who just graduated with a degree being a PA physician's assistant. Doesn't like California. Wants to move here. I go, okay, what's your name? Give me your name. I'm going to call her. And I know I recruited somebody out of our interviews for our PIO. We actually got the call from somebody who said his friend wants to move up here and does mental health work. And I'm like, okay, let me get their name. So we are out there looking.
That goes along with the question. If you smoke for high school, what does your wife do?
Unfortunately, you can't work here. We should have got a trade or something on
Which
that.
we did not ask in the interview.
I'd like everyone to ask that. Thank you very much.
Okay, thank you. We will transition to the sheriff's office.
It's okay.
Yes, cannot ask that.
I look forward to it.
I appreciate this one.
Okay, gentlemen?
So try to stand up when you can after a $19 million meeting.
Yeah. Well, I found out the hard way last week. I ended up with hip flexor injury by the end of the week from all that marathon meeting.
I got to talk to the chairman about this whole. This one's getting you from this angle.
That's not my good side either.
I'm just saying.
That one, at least there you're back, but they really can't see your face. So
Yeah. Yeah.
So when you roll your eyes, they can
Get Captain Fox to put the flashlight right behind your head. Silhouette.
So did you already have these?
Okay.
It's a good thing. He met us, so he didn't PM.
If they don't need to, then that's up to
Well, he did that evening when we were out talking with dinner. He was like, I'm not tired of it.
Analyze it. Something on the table.
Yeah, we could do that.
Any human being.
Are you ready?
I think we are.
Okay. Item 4, Sheriff's Office, led by our new sheriff, Track.
Thank you. Good afternoon, Chair Hidgmans, Commissioners, and members of the Budget Committee. I've been asked to start off by doing some quick introductions of our staff. I'll just start over there on this side. Debbie Howard is our Chief Financial Officer, Fiscal Manager for the Sheriff's Office. Sergeant Kerry Carver manages our functions for public information, media, and manages our volunteers, those kinds of duties that keep us very busy. Chief Deputy Greg Fox was recently appointed the Chief Deputy spot. Made the internal adjustments with the change in sheriff. Captain Cliff Harold, Police Division, and Lieutenant Chris Doyle, also in the Police Division. Dan Buchwald is Captain assignment for the Corrections Division, and Steve French, Lieutenant Corrections Division. And Greg Rice is the Sergeant in our Professional Standards Office, which is our internal investigations, disciplinary functions, and managing our policies, general orders. Is that everybody? I forgot everybody. Okay. Thank you. The Sheriff's Office is excited about this year's proposed budget and what it provides to our community. We know it does not provide fully the services the community has said it desires from us, but it does provide services the community has chosen to support. The proposed budget does something very important too. It meets Phase 1 of Lane County's 10-year public safety plan. It keeps the public safety services that we have in place today. This is critical, and it allows the county to continue our efforts on the next phases of the public safety plan. The proposed budget allows the Sheriff's Office to actively participate in the county strategic plan. As you can see, the Sheriff's Office is actively supporting the side. There you go. The Sheriff's Office is actively supporting the strategic areas of focus. In support of a safe and healthy county, our Police Services Division provides emergency response to life safety events throughout our community. We also provide effective investigations of serious crimes. To maintain our vibrant communities, the Sheriff's Office provides services which help preserve our natural environment through education and enforcement. The Sheriff's Office has a good track record of building and maintaining our internal administrative infrastructure. We are constantly developing our next generation leaders through career development efforts, both formal and informal. You will hear from several of our staff participating in such an opportunity with you here today. They are, and I've already introduced these, they are Dan Buchwald. He's acting in capacity as captain for the Corrections Division, in charge of the jail and all corrections functions of the Sheriff's Office. Steve French is a lieutenant in the Corrections Division, and Greg Rice, sergeant assigned to professional standards in the Administrative Division. And Chris Doyle is acting in capacity of lieutenant in the Police Services Division. Each will share with you an overview of the division in which they are assigned. And first is Captain Dan Buchwald.
Hello, everybody, and thank you for this opportunity. It's all the stuff on the belt. I'm losing the weight, okay? Let's see. Okay, so Corrections Division. Obviously, we have several components: the main jail, the Community Corrections Center, the Sherman Center, which is the Defendant Offender Management Center, and the electronic surveillance program. The Corrections Division is funded through a variety of sources, to include the serial levy, option levy dollars, rental beds, fees for service, and general fund monies. The Community Corrections Center is actually going to, next year, will celebrate their 30th year of assisting offenders transition back into our community. This program does not receive general funds. ESP has expanded their services to provide assistance in monitoring parole and probation high-risk clients that are on supervision at a reduced cost. The Defendant Offender Management Center. This is the hodgepodge of all the programming. The folks actually keep their thumb on the pulse of what happens in the jail. We have folks that work in, deputies that work in pretrial services as a collaborative. All of our road crew, community service, and sit-in program and education programs all housed in the Sherman Center. We also handle all of the classification reviews, and appeals. The education program, we're back up and running after our shutdown for the last couple of years. This has always been one of our best programs as far as folks actually doing time while they're gaining their education, which is evidence-based. The Sheriff's Work Crew, it's been a very good year. We made ourselves available to multiple agencies here in Lane County. This actual picture here shows the folks pulling up noxious weeds. They are obnoxious. Noxious weeds from the coastal Florids. The other one is a picture of removing briars at the Cottage Grove transfer. The Community Corrections Act bought us a deputy. This deputy works on Lane County projects only, and it's been a big hit with all of our partners in Lane County. This was actually a cooperative with land management and solid waste. They removed over 1,000 tires there. And real quickly, not too long ago, we had a serious situation on the river where the homeless camps had left all the garbage there. The concerns were the river was going to rise and wash all that out to sea, and we were able to make that disappear in a very short amount of time. Our community service program, this is where our deputies actually work as liaison with the courts and the nonprofits, so that offenders can actually complete their sentence without completing jail time. So it's based on hours of community service. And this is yours truly, Lane County Jail. I'll turn over to Lieutenant French.
So the Lane County Jail, just like all jails in Oregon, don't have the ability to pick and choose the inmates that are brought into custody. As a result, a significant portion of those inmates that are brought in are under some kind of crisis, have some kind of medical, mental health, substance abuse issues, and or just antisocial behaviors. Many of these folks don't care for themselves when they're not in custody, and the jail is required to provide a standard of care to the inmates in our facility. This significantly increases the costs, obviously. Capacity-based releases. I'll talk a little bit more about this, but I just want to make sure that everybody understands what this topic is, what the definition of the capacity-based release is. And it's simply inmates that are released from the jail to prevent overcrowding. The jail operates under a federal consent decree which limits the number of inmates in custody at any given time to 93% of capacity. The CBR score is both a combination of current charges and past charges, and it is assigned to each offender, and those scores are based on a validated computer program. There we go. The public safety levy that was passed by voters in May of 2013 doubled the number of local jail beds available for offenders. It went from 125 to 256. This had a significant decrease in not only the number of capacity-based releases that we're seeing, but also reduced the dangerousness of those offenders that we're having to release to the community due to overcrowding. This is just a quick slide to show you how Lane County, with the current bed that we have, how that is in relation to the Oregon average and the federal average. We are at about half the Oregon average and about a third of the national average. This is a slide that just shows about 30 years worth of history of the capacity of the Lane County Jail. Obviously, the jail capacity is in relation to the number of, the funding that's available for staffing, other facility costs such as inmate mental health, medical care, utilities, that kind of thing. These two graphs just show what kind of an effect the levy has had on the capacity-based releases. The graph on the left compares fiscal year 12-13, which is the year prior to the levy and the reopening of jail beds. We had a little over 5,000 capacity-based releases. The year following the levy, the year after we reopened the beds, we had 1,289 capacity-based releases, so a big reduction in the number of CBRs. The slide on the right kind of shows the type of inmate that we are releasing back to the community due to overcrowding. The graph on the left, the column on the left in red shows, once again, before the levy funding went into effect and the reopening of the beds. And we had 235 offenders that were released from jail during that year who were pre-trial measure 11 or in custody for violent felonies of some type. During fiscal year 13-14, we did not have any, and during this fiscal year, we have also not had any. So, big reduction in the number of CBRs that we're having, and also the dangerousness of those offenders that are being released. Moss Adams completed an audit of the levy funding usage earlier this year, I think in January, and they found that the levy funding is being utilized by the county as it was anticipated and approved by voters. In the Corrections Division, the jail, the Defendant Vendor Management Center, Community Correction Center, and Electronic Surveillance Program, we're all working with different public and private nonprofit agencies in a collaborative relationship to try to develop some services for inmates, not only when they're in custody, but also when they're released and they're transitioning out. Most of these are evidence-based practices that have been shown to have a reduction in recidivism. We are also trying to be good stewards of the public funds, and one of the ways that we're trying to reduce costs is by contracting. We're currently contracting out inmate services for medical, inmate food, inmate commissary, inmate telephone, video visitation, and electronic surveillance equipment. Last year, we completed a RFP and contracting processes for inmate telephone video visitation and commissary. This year, we're involved in an RFP and contracting process for medical, mental health, and dental services. So we'll turn it over to Greg Rex.
I'm not kidding, Captain. Apparently I need to lose the weight too. All right. I'm going to go over the administrative division with everybody. The purpose of the administrative division is to support all divisions and programs within the sheriff's office. Just a few examples of the sections in the division are dispatch, training, and records. When someone calls the sheriff's office for help, the first voice they hear is one of our dispatchers. Dispatchers are responsible for obtaining vital information from distraught callers and then relaying that information to responding deputies. At the same time, dispatchers are entering all the information into the computer system. In 2014, dispatch handled just over 92,000 calls. Some other duties that police records and central reception are responsible for processing are police reports, restraining orders, and stalking orders, sex offender registration, and concealed handgun licensing. I want to point out that in this last year, 430 sex offenders were registered, which is an increase of 62% since 2012. Examples of duties that the jail records are responsible for are processing bookings, no contact orders, and court paperwork. Jail records is also a primary resource to answer questions from the public or other law enforcement agencies. In 2014, jail records processed almost 14,000 bookings. The Sheriff's Office only has one property evidence technician. The property and evidence technician processes all submitted evidence, handles prescription medications turned in from the drug take-back events, and when allowed by law, returns property to citizens or submits the property for destruction. The property and evidence technician can also be called out to a crime scene at any hour and any day to assist in processing evidence. In 2014, just over 5,000 items were submitted for processing. Emergency management is mandated by Oregon Revised Statute and is staffed by one person. The emergency manager partners with local, state, and federal agencies during natural disasters. During the Deception Creek fire, which is what the picture is right there, the emergency manager helped coordinate the potential evacuation of local citizens affected by the fire. The three core components of emergency management are planning, training, and exercises. Emergency management creates emergency plans to effectively deal with all different contingencies that could occur during an emergency, ensures appropriate training is delivered, and also conducts exercises to identify any potential weak spots in an emergency plan before an actual emergency happens. The fiscal section processes the Sheriff's Office revenues, expenses, payroll, and contracts. They are also responsible for preparing and managing the annual budget, as well as managing inmate funds and inventorying and issuing equipment and supplies for the entire department. Through the fiscal section's hard work, the Sheriff's Office continues to aggressively search out and apply for grants. Grant funding awarded to the Sheriff's Office includes Dune Patrol and Emergency Management, as well as funding for our partnership with the Lane County Drug and Veteran Courts, which support FTEs and other county departments. Through grants the Sheriff's Office has been awarded, we are able to partner with local agencies such as Sponsors and Emergence to provide treatment, housing, and education to assist those involved in the criminal justice system in an effort to stop the cycle of recidivism. The training section ensures that staff receive training that is mandated by law and required to maintain our certifications. For example, we do EVOC and firearms training, which is pictured here. To reduce costs, the training section has created courses that staff can take online and has coordinated with other agencies to participate in joint training opportunities. The Office of Professional Standards conducts internal investigations to provide accountability to the public and to ensure that staff conduct themselves to the highest standard. Also, the Office of Professional Standards administers the process for implementing and revising policies and procedures. Human resources for the Sheriff's Office are provided by Lane County Human Resources. With the passing of the jail levy, the Sheriff's Office has been in a constant state of hiring. Human Resources have been busy processing 600 applicants so far. We have yet to fill all the positions funded by the levy, so it's anticipated this number will grow considerably by the end of this year.
The Public Information Officer provides the media a contact person to receive important information regarding events that are happening in the local community. The Sheriff's Office uses different forms of modern media formats to better serve our community. We use the formats to actively engage community groups to enhance communications with community members and to provide crime prevention information. Volunteers are heavily used throughout all sections of the Sheriff's Office to help us serve the community. A prime example of this is the crime prevention team. Not only do they set up the speed trailer pictured on the right, but they also provide free home security inspections to community members to help them decrease their chances of becoming burglary or theft victims. The Sheriff's Office partners with the Emerald Valley Rotary Club and Cabela's to put on the annual Life Jacket Exchange. This program allows community members the opportunity to exchange personal flotation devices that their children have outgrown for properly fitting ones. This partnership between the Sheriff's Office, Rotary, and Cabela's helps our community members enjoy our lakes and rivers safely. And with that, I'm going to turn it over to Lieutenant Boyle.
Good afternoon. We'll talk about the Police Services Division. So currently it's led by Captain Cliff Harold and myself. To give you an idea about the size of the area that we patrol, it's 4,722 square miles, which is roughly the size of the state of Connecticut. And here's some stats on our current staffing. We've got a captain, a lieutenant, admin assistant. We have 21 deputies out of the main office, that's what we need for 24/7 coverage. However, we're due to retirements, resignations, and we're constantly in a training mode. We're only currently have 18, so we're only covering 20 hours of patrol right now. We're having to call out people for the other 4. And we just had 5 deputies that they completed their field training, and they're out on their own now. Some other stats to give you an idea about where we're at as far as our staffing levels compared to the national average. That's about 2.51 officers per 1,000 population. The Oregon average for state and local law enforcement agencies is 1.77 officers per 1,000 population. Then if you just look at the Oregon Sheriff's Offices for the 36 counties, that's 0.61 officers per 1,000 population. And then you can see where we're at, which is 0.17 officers per 1,000 population. To give you an idea about how short-staffed that is, just in order to get back to the average for the Oregon Sheriff's Offices, we'd have to hire about 140 deputies in the Police Services Division.
You have a pair of shoes.
Yeah.
That's always good.
Here's some of the things due to our staffing levels that we're not able to respond to, which is most commercial burglaries, motor vehicle crashes unless there's a serious injury or fatality, property theft and property damage. And then citizens have to submit their own citizen self-report form to report these types of crimes. And what's significant about that is that you can see that there were 92,402 calls for service received in 2014. 8,386 weren't even dispatched. We sent 2,039 citizens CSRs, or citizen self-report forms. And what's significant about that is we know we only get about 30% of those back. And so it makes it look like property crime in Lane County is down when we know it's just not being reported. Additionally, with that, we frequently talk to repeat victims from theft and burglaries, and they tell us that they don't even call in the second time a lot of times. It's just frustrating for them. So this kind of gives you an idea about what happens when you have short staffing and then a large county and a large population and the number of calls we serve. This is a briefing note about a deputy that got called out. It was about 4:45 in the morning from his house. He was next on call, and it took him 1 hour and 39 minutes to respond to a death investigation over in Florence area. So our call response time can be pretty significant. Here's some stats on on some of the calls that we're going to. We've had 79 death investigations so far since January. 55 police officer holds. Police officer hold is where we take somebody into custody, usually for a mental health crisis. They're either a danger to themselves or others. And so far, 228 calls for suicidal subjects. So it appears that the mental health could also use some resources as well. I'll talk about the criminal investigation section, our detective division. This picture is from the McFadden-Kelly double homicide, where the suspect lit a fire to conceal the crime. You can kind of see. We have a sergeant and 4 detectives that process a scene like that. You can imagine how time intensive, and that just gives you a little look into what that might be like to process through that. Again, we have 1 detective, sergeant, and 4 detectives. There's some stats there on some homicide investigations. Significant to note is that the detectives are primarily investigating felony crimes, but either physical or sexual abuse of children. And these are 90% of what they're handling. In addition to that, we're also jointly responsible for an interagency deadly force investigation team, which that team investigates use of force incidents in the county. To give you an idea about how the staffing for the detective division, how it compares to other places, Eugene PD has got 27 detectives for the 159,000 people that they serve. Springfield Police has got about 14 detectives for the 60,000 people that they serve, and we have 5 for the 115,000 that we serve. Resident deputy program. We currently have 3 resident deputies, 1 in West Lane, 1 in South Lane, and 1 in the McKenzie Mohawk. These 3 deputies were brought back with a COPS grant, however it wasn't renewable. We were really fortunate to have it funded this last fiscal year, and we're hoping to keep it for this current or this upcoming fiscal year. What we like about the residents is that they're closer knit with the community. The community really likes them. We get a lot of good feedback from that. They're more familiar with the problem children and people that they can go to get information. We're also heavily involved in neighborhood watch in the schools and community meetings. Sheriff's Patrol contracts. These are about a quarter of our police services deputies that are in the police services division. They are with the City of Crestwell, contracts with the City of Bonita, Marine Patrol, BLM, and Oregon State Parks, which is Dune Patrol. What's kind of significant about this is that because they're a quarter of our police services deputies in the division, it kind of makes it look like we have more people than we really do. And these contracts, they're tied to the money that's coming in. I mean, the people that are paying for the contract have a specific job for them, so they're not able to handle general calls for service. But what happens a lot of time is, like we'll get complaints where somebody says, "Hey, I see a deputy out on a lake. He's working for Marine Patrol. He wrote me a ticket for not having my life jacket, but he won't come and help me out on my burglary." And so then we have to end up explaining, why that is that they weren't able to do that. So. Our civil transport section, 1 sergeant, 2 deputies assigned to that. They've had a really increasing workload with regard to real property sales. You can kind of see there, there were 19 of those sales in 2010, 15 in 2011, then it bumped up to 98 in 2012, and then you can see 408 in 2014, and then we're already at 203 in this first quarter of 2015. What's significant about that is that sheriff's offices that typically handle that amount of workload, they've got about 10 deputies doing that, and we've got 2. They're also responsible for serving priority paper services in the within the urban growth boundary, Eugene Springfield, which is restraining orders, stalking orders, evictions, things like that. Because they're so busy with those real property sales, they're having to do that on overtime, or we're having to grab deputies out of the transport division during court breaks to get that done. Our civil transport, or the transport section, there's 6 deputies assigned to that, and they're the ones that are transporting inmates back and forth from the jail to the courthouse for court appearances. We also transport inmates to Marion County twice a week that are sentenced, that are going to the state penitentiaries, and they'll do medical transports. And then I've talked about that they'll help out with serving priority civil papers as well. Our search and rescue program, this picture, I'm not sure that this is quite in the right order here, but this picture depicts a hiker recovery from the Middle Sister, where a hiker fell off a trail and ended up dying. National Guard helicopter there in the background that brought in resources to get that done. Let's see. Search and rescue is comprised of 8 individual groups. You've got Eugene Mountain Rescue, Water Search and Recovery, which is the dive team, more commonly known as, ham radio operators, Special Vehicles Group, which is a group of guys that have got 4-wheel drive vehicles that can go out and help us search for missing people, Sheriff's Mounted Posse, search dogs, ground search and rescue, and then the Explorer Post 178. And in the picture here, you can see some of the volunteer divers. You don't see the body that they're recovering out of there, but it's kind of a complex operation. So, and with that, turn it back over to Sheriff Trapp.
Thank you for your time, and I think it's obvious where our weak link is this year. I think we've made great strides in the last couple of years getting the jail up to about half of the state's average. But as you can see, for the size of the system in Lane County, it's working pretty well for the moment. We're struggling tremendously in our first division, and you can see that by the information presented by Lieutenant Doyle. We'll continue to work on that. We're hopeful we can make some headway on the public safety plan efforts and work through that. And we're open to any questions you may have at this point on anything in the Sheriff's Office.
So, Sheriff Trapp, and thank you very much for all of your reports. Really appreciate it. So the question I have really kind of centers around the emergency management piece of it. So in March, this early, I was at a briefing with Senator Wyden over talking about with the U.S. Forest Service and BLM, already talking about forest fires. Today's not indicative of what's been happening here, obviously. This is the first time in my memory that Mount Bachelor did not get over 100 inches. I can't even remember that, to be honest with you. So we know the snowpack is down. So maybe based on like for instance with the Deception Fire, so based on that, where are you as far as the preparedness is when it comes to this potential? Maybe is, in the last couple of years have been tough. And how the reimbursement structure is in place. So I saw the partnership, for instance, with the BLM, and I think we understand the BLM is with their contract with the State Department of Forestry. But let's say there, for instance, there's a fire up in McKenzie on U.S. Forest Service lands, which doesn't necessarily have a great reputation as far as fighting forest fires. So if you have to be involved in that with maybe making sure people are not in the way of, maybe explain a little bit about the reimbursement structure, how that is handled, and the timing of that, because I think there's a real chance that Lane County Sheriff's Department will be involved in this potential, and maybe just kind of give us an idea of how that, because when you're looking at the budget and understanding the Sheriff's Department's already tight, but also understanding what the potential responsibility is. Maybe we've just got to go through that.
So I don't know if maybe Debbie can help me with some of the numbers for sure. The one topical expert that I don't have here today, that she already shared her time with you earlier at the meeting talking about the drought emergency, is Linda Cook, our emergency manager. She would be best to speak to this, but as I understand it, and I don't know what the exact ratio is, but the emergency management, Oregon Emergency Management, and FEMA require for an emergency to be declared and reimbursements to occur, there has to be a threshold of property loss, both in public property loss or personal property loss. I don't think Lane County has ever been successful in reimbursements in personal property loss. While we've had substantial personal property losses and impacts, the floods of 96 and then again in 12, you can see there was some significant mitigation efforts in Mapleton after 96, where they elevated several houses to prevent future significant property loss. But even in those circumstances, we didn't meet that threshold. We have been successful in meeting the threshold for public property loss, government property, utilities, and most recently was the last snow event a year ago. I guess there was no snow this year, where we actually, through primarily the efforts of emergency manager Linda Cook, she reached out to all the utility companies in the area and Public Works and other public entities that were involved in any kind of efforts toward that winter storm, and quickly established that Lane County, almost by itself, met the state threshold for emergency declaration. And then that prompted the state then to engage other counties and further identify the actual loss suffered, and then that met the eligibility for FEMA reimbursements. And I believe Public Works and the utilities received, I think it's a 75% reimbursement of those dollars. The problem with the Forest Service scenario that you outlined is that that's going to be, I don't know that historically that we've been in a position to recover losses from that, and a lot of our direct involvement with the Forest Service often would be on a contract for security services. We haven't had a fire of substantial size for several years, and so I'm not sure where we're at as far as staffing, ability to meet the need of a security contract operation with the Forest Service. If that was to occur this summer, I think we're much less prepared to do that, just as far as available staffing and manage our ongoing operations at the same time. As far as preparedness, I think we defer most of the forest management and fire preparedness to the fire districts and the State Department of Forestry and those, and we are always prepared to coordinate with them, and we were, I think, very quickly able to integrate our services, both search and rescue, emergency management, volunteer services, posse, and a number of others to coordinate with the fire management team at the Oak Ridge Westford Fire. And we quickly had canvassed several neighborhoods in that area, and made personal contact with property owners, told them of the pending plans for evacuations, and we're standing by. I think we stood up command post, the fire moved, we stood down the command post, the fire returned, we stood up a command post, the fire moved, we stood down the command post. We did that a number of times, providing staffing and resources through a lot of volunteer effort and a lot of our managers. So we would continue that in any form, wherever that may arise. And I can certainly follow more specifically if you need what the state threshold dollar amounts are, but I don't have that in hand.
No, that's fine. It gives us a snapshot, and I really appreciate the answer. And again, thank you for the presentations. Really appreciate it. Thank you.
Thank you. Just to tack on to Commissioner Lycan, we already had our first 7-acre wildfire outside of Florence last week. Just so people know that. It didn't really make the news or anything, but it was a slash pile that we ignited after 3 months. It was originally burning everywhere. I got a couple quick questions and here. One of which I just want to get out of the way because I get asked it all the time, is the use of military vehicles and whether they cost. How can the county afford that? We don't have the police. You just outlined how we don't have adequate police services. How can we afford these military vehicles, and what good are they to the county, and how do we use them? I think people don't understand how it actually keeps folks safe because it doesn't put you guys in a shoot-don't-shoot situation when you're behind some bulletproof armor, but and also how they get utilized even in say flood evacuations and all that stuff. But could you talk a little bit about whether that costs the county any money and how we obtain those vehicles and maintain them?
Well, and the reason that we have the military vehicles is very simple. It's cost, which is zero from the military. We don't own them. They're on loan from the military through the military surplus program, which we have been a participating agency in for many, many years, probably decades. We used to obtain replacement helicopter engines when we had military surplus helicopters. We've obtained all kinds of equipment. Much of it is not military. A hospital bed for the jail medical section, office furniture, things that we've already paid for with tax dollars. The military has decided they no longer have a purpose for it. They're providing it to local governments to repurpose and continue to use. And so if we can save dollars and obtain good quality equipment, and some of it comes nearly brand new, some of it well used, and we're able to pick and choose the quality and if it's available to us and then put it to use. The vehicles specifically, we have had military surplus vehicles ever since I've been around the sheriff's office. Years and years ago, in the late 80s, we had military surplus trailers for search and rescue. We had they called it Deuce and a Half, the old World War II style heavy truck for search and rescue. We had enclosed trailers and truck boxes for radio operations. So this isn't new. If you want to use the term militarize the sheriff's office, we've done that since the 70s, 60s. I don't know how far back we can go, but it's been a standard practice, and it's because of the cost and affordability. The purpose of the vehicles are, just as Commissioner Bostic had mentioned, they are a safety vehicle. We have used them to evacuate residents under protection of the armor from an active shooting event in their community. Certainly that protects our deputies, allows them to position themselves much closer to be able to interact and deal with the resolution of the circumstance that we'd otherwise be significantly distanced from and at a disadvantage for being able to manage and address and resolve those things. So clearly there's a safety component in most times that's directly benefiting the deputies that are using that equipment. But it's also significantly available to the community and individual members as needed. The equipment's not exclusively tactical or enforcement. We've used the equipment, certainly the Humvees. We have the occasion to use them on the sand dunes in Florence. We have a vast sand dune that we respond to out there. And we have floods both in the Florence coastal area and usually Mohawk Valley that we've used. The Humvees, they're fairly deep water capable. Even without the snorkel systems, they can drag to about 3 feet of water, and we will quickly float a pickup doing that. So we've used those for evacuation, accessing those kinds of roads and driveways, checking on residents, providing evacuation assistance. In the snow, we've taken the Humvees up on the snow roads in the forest patrol teams when they were still active, and have rescued many a four-wheel drive enthusiast who thought they were more capable than they were. So you name the application, those vehicles have a very significant application. They don't have any military weaponry on them. They're not weaponized. They're not in any manner to be considered a threat to the community. But what they have saved us is tens of thousands, probably hundreds of thousands of dollars, and provided us a similar level of protection for our staff and our community that other police departments that are more financially comfortable buy. The non-military civilian police purpose-built armored vehicles that do the exact same thing are $80 to $100 or more $1,000. We clearly don't have that, and never will, probably in my career. So this is our only opportunity to obtain this, and it's not just armament and weapons. It is, you name this hit the news media here recently. We tried really hard. Sergeant Carver did a phenomenal job. Lieutenant Doyle spent a lot of time going over this with the media. Former Sheriff Turner and I spent an hour on the telephone with a reporter from the Oregonian who promised us he would share all the good things that this military program has provided the Sheriff's Office. All they ever talked about was how many guns we got, how many tanks we have, and how scary and militarized we are. We don't have any tanks. We have a few guns. that we don't use. That we're early on in our trying to acquire long rifle systems for our patrol. But it's a no-win with the media, and I'd be glad to talk about this all day. It has tremendous benefits, and I think it gets a bad rap.
Yeah, I just wanted to make sure we covered the budget impact.
That was more than you wanted.
That was a little bit more than I wanted, but it was good that you clarified.
You opened the door. All right.
So I'm going to open another door real quick. Body cameras. You have 1 FTE in evidence, and there's some talk about making requirements for body cameras, et cetera. Can you speak to the financial, budgetary impact of having to keep track of gigabytes of video and dealing with that as a sheriff's department if you were required to have body cameras?
Well, with any luck, it'll be a funded mandate. If it's not, we're in trouble.
And the tooth fairy is coming to my house.
Yeah. If there is no funding associated with a mandate, we will be in trouble. Captain Harold can maybe help me with the dollars, but I think it ranges from about $200,000 to $400,000 potentially, depending on how we need to manage is that about right?
About right, including additional.
Yeah. So we're about $150,000 in just buying the equipment. And there are some grants I don't know the name of, but I think we've had some business members that have offered to provide some support financially for us to buy into it. That's the cheap part. Buying the cameras, getting set up with the hardware. The difficult and expensive part is managing all the data. And now there is a cheaper alternative. We did a 30-day test trial free through Taser, who now, in addition to the stun guns that people have seen for years from them, they make a camera system, and they have a cloud storage-based data system. So one of the big expenses is buying the servers, and those quickly go into. We struggle with this in the jail. We have cameras all throughout the jail. We would love to have the ability to maintain our jail video data much longer, but for us to store it even a few months in the system is unaffordable, and that's a critical video data. For the patrol group, it's what it looks like is the cost of storing the data and the hardware is the limited side. Really what it's costing us in our evaluation is at least 1 FTE, probably 2 FTE to do nothing but manage the data. That would be including the records request response, providing the redaction system or services on all the videos that go out. I think we had staff that played with the redaction and the software that's provided by Taser. They said you can do that in about 10 minutes. I think it took about an hour for the first video clip for 1 minute of video. Now, granted, the more time we practice and spend working on it, we can probably pare that down. You're never going to get where it does, and you have to have a supervisor managing it. It is evidence, and there are protocols that have to go with it to be effective. And then it's the more up the evidence process you go, it's more complex with the storage, the transfer to courts, and public records releases. So we realize that we can't afford another $200,000 to $400,000 out of our program. What that would equate to, if we're mandated to do it, we will take 2 FTE and apply to it, and we will have 2 less FTE in our service delivery. It's as simple as that. It's a trade-off.
So the cost process on part of it.
Right. I don't know how you pin those on your shirt, but
yeah. So thanks for answering that. I just think a lot of people think that that's the end-all answer to a lot of the issues with police.
And I'll just clarify that from our perspective, the staff that did the trial run were very supportive of it. Some of them said if we had these, I'd wear it every day. 1 or 2 were a little less enthused, but still supportive of it. In general, we are very supportive of the concept. I think there's nothing about it that hurts law enforcement. If it makes us behave better because we're wearing a camera, it's a benefit. If it eliminates frivolous complaints, it's a benefit. There's nothing about it, I think, that hurts us, except the affordability and reducing our service delivery capability.
It's the data management side that's just nearly impossible to deal with. It's gigabytes of video. Last question, and I'll let somebody else ask you questions. You mentioned, in that presentation, that Work Crew was self-funded and all that. That's somewhat true. I know that there's one crew that's comes right out of the House Bill 3194 grant funding. There's other sources of where that funding comes from, and there's
I think the clarification was self-funded, not using discretionary general.
Not using general funds.
Yes.
Yeah, it kind of actually.
Yeah.
But kind of the implication was there was some kind of self-funding there. But there are other sources of funds, and particularly a lot of the other services that were mentioned for your population that you're trying to connect them with, whether it's treatment services or sex offender services. A lot of that's coming out of either CCA funding, the Justice Reinvestment Grant Program, or other sources of funding that
Bureau of Prisons.
That right now are pretty unsteady. I mean, we're looking at possible cuts in our CCA funding because of our lack of prosecutions, reduced our offender populations, where we're down to. We used to be 10% of the CCA funding statewide. Now we're down to 8-point-something%. I can't remember what it is this biennium, and we're still in that downward trend. Can you speak to how critical some of that outside grant funding is to a lot of the programs that you mentioned?
What's the total jail capacity right now today?
Total jail capacity right now is 351.
351.
Our cap is 326.
Okay. So we are 351. We have local jail beds under the levy funding of 256. So there's about 90-ish beds that are funded by external sources, Bureau of Prisons, contracts with City of Eugene, those kinds of things. The programming, services, all those other costs are kind of factored into all levels of the jail population. Those services are provided to everybody. I don't know exactly, I'll let corrections staff jump in here. I don't know exactly if some of those service delivery components would have necessarily reduced our jail capacity, but they would certainly eliminate our ability to provide evidence-based services and programs that directly impact and have been proven to impact recidivism. If there's anything more to add to that.
So you're correct. It hasn't necessarily limited what we're doing in the jail. It's the partnerships and collaboration that we're building inside of the jail. For example, probation with sponsors. We plan on having private-based training brought into the jail. Our goal is to start our local offenders that aren't going to prison. Start on cognitive behavioral training here in the jail. Take that into our alternative programs at the Sherman Center, and then we make a handoff to probation. So tracking all those hours, dosage. We're still being successful. We're doing more with less. But by extending ourselves and partnering with our agencies, we're actually able to do more.
So some of those other funding sources you mentioned, they will cut into our ability to do a lot of what was just mentioned, but not necessarily have an immediate or direct impact on the jail bed. The other thing is, as we built the levy, we built the levy from the bottom up, so if all those other sources of revenue go away, we still meet the promise and the mandate of the levy with the local jail capacity. What we will lose is the funding that supports the difference between 255, the minimum jail bed promise of the levy, and whatever the capacity is today because of other sources at 351 today.
Thank you.
I have a bunch of questions regarding some of the items that Kevin Buchwald was talking about. But I'll put them on cards. I think kind of right now. But it's important for everybody to understand that we don't just police. We have an education program in the jail. It's really pretty exciting. The education program is back at the moment. The first time I visited the jail, I saw the room where it used to take place. And I thought, what a great asset that is for the jail to actually have people leave their term in jail with more than they came in with an education that they probably wouldn't have gotten on the outside. Not that it's not available on the outside, but you're giving it to them in a very real way, so that we are actually rehabilitating folks while they're in the jail, providing them with the means to have a different type of life once they get out of jail. I'd love to hear more about that. I will have some questions on cards so that we can get more information specifically about it. Also, the debris cleanup. That's pretty interesting and pretty important. Hearing from from John Brown, for instance. I've been hearing from him for 18 years now about debris on the riverside, and just to hear how much effort we put into that and how effective it is, the work that we're doing. So once again, Mr. Chair, I'll put these questions on the cards. It's important that we hear about it because we hear about the policing services, we hear about the jail services, but our Sheriff's Department is involved in such a broad range of services. And, I'm looking back at the history of the sheriffs. And back in 1851, when we first had a sheriff, we talk about a county the size of Delaware, about 4 times the size of Delaware, excuse me. 4 times the size of Rhode Island, twice the size of Delaware. But, that Lane County back in 1851, its eastern terminus was the Continental Divide. So part of Yellowstone Park used to be in Lane County. So at least we don't have to trot our horses out.
And they probably had less staff than 1850.
I think, in looking back there, they were kind of crusty looking, right? You might add. But really, kudos to the Sheriff's Department, not just for policing, and not just for the jail, but for all the other things. It really is, it's one of the finest foot forward that we have in Lane County. One of the first things that people recognize about what we do as a county is the men and women in uniform and how well we do your job. So thank you for that. Thank you.
Sheriff, thank you very much for coming today and presenting this budget. I really appreciate your leadership. I have a couple of questions. First is that there was some controversy when the board, at the request of the previous sheriff, made a proposal to take the medical services out of the control of the sheriff's office and contract out those services to an outside firm, and the board was rather split. It was a 3-2 vote of the board to authorize it. How is that going to have the contracting out of the medical services?
Well, it's been, we in year 3, finishing year 3. We're finishing year 3 with the current company we've contracted with during that time, and we have just completed, or in the process of concluding, an RFP, and we're hopeful to make an award to a contractor that will begin June 1, or July 1, June 30, the fiscal year change, and continue that. So we've been doing it for some time. It's working. It's the only thing I would say is I think it's still in the control of the sheriff. It's just not the sheriff's office employees. They're not county employees and sheriff employees. They're contracted employees. We've learned some things along the way. I think we have learned it's saving money, which was the goal. We weren't looking at it to reduce our employment numbers or minimize the jobs we provide by any means. That was what we're trying to not have to do. But it is a cost savings function that continues to show us savings. And in the short run, to reverse that would be, we could probably do it, but it would take some time and a lot of coordination with whoever's the contract agency or entity at the time providing the service.
The cost has always been to advance this idea of contracting out these services, as it's been that you will save money on the beginning phases of it, but that as the and I'll use this term, shortcuts that they might use come in, you get more costs because of litigation, because of things that are outside of the control of the sheriff, and we get shoved into it, and then over the long term, you in fact have not saved money. I'll ask it this way: would you be open to the idea of looking during the time that we have this new contract at the full cost and whether we should go back to the previous system?
I'm open to looking at anything. I think what we're showing is that we have cost numbers of what we save. We can get that to you. Yeah, we could get that to you. But I think what we're seeing is we're still saving money. So if we do reverse it and we go back to employing our own medical staff and our own food services staff, we're going to have to come up with another chunk of money out of our budget. And we can have that discussion. But then it gets back to, do we want to have body cameras and eliminate 2 FTE providing police services? Do we want to go back to employees working for the actual county employees providing those services instead of contract? And does that cost us another $1 million a year? Where do we come up with that? So I mean, I'm great having all those discussions. My concern is reversing this and going back to a higher cost service. I understand what you're saying about, the litigation. We've had litigation always, and we always will, regardless of whether we have our own employees doing the service or we contract. We're in the middle of testing how much we save with litigation right now, and we'll see how that unfolds. I don't think we will be cost more in litigation. The hope is we share that litigation with the contract partner. So in theory, our litigation costs should be lower. But that's a long-term evaluation, certainly not a 3-year window. But yeah, we're open to all that. I'd be hesitant to go back and reverse the program if it costs more money.
Kind of new topic, but you mentioned the partnerships in the search and rescue arena, and I'm curious about the relationship with Civil Air Patrol and other organizations. I guess the Oregon Air National Guard would be in that category, but just people with helicopters, airplanes, and vehicles of that type that may not be traditionally in a sheriff's office, although there's no reason other than money why they couldn't be. I understand that other sheriffs in adjacent counties do work with Civil Air Patrol. Do they have more money? Is that why they do it? Why don't we do it? Or do we do it?
We do. A perfect example is, you'll have to help me with time frame, but just a couple of weeks back, we had a missing pilot in a small airplane out of Crestwell. He was found, his plane wreckage was found just out of our county in Lynn County on the Coburg Hills. And we had employed the resources of Civil Air Patrol for those days previous to that. They were doing flights. I don't know exactly who found the wreckage. It may have been Civil Air Patrol. I don't know if anybody.
They spotted a possible site, and the National Guard was able to bring in helicopters.
Yeah.
But our STAR manager and Lynn County STAR manager were spending hours together for a number of days.
Do we have to pay for Civil Air Patrol? Do we have to pay for Oregon Air National Guard?
No. The National Guard, I don't believe there's a cost to Civil Air Patrol. It's just coordinating, and they love to do it. They call us all the time, say, when you have something, call us. And so we do. We just don't have events that their service is necessarily needed or that specialty is the best option at the time. But when we have a circumstance that it's appropriate, we certainly call them. And the Air National Guard, we've had a long relationship with them for many years. They have been gracious to send us their helicopters for any number of searches. And when they're unavailable, which occurs on occasion, we also can, depending on how far inland the Coast Guard has been willing to be a
I think Air National Guard just has jets, and I think it's Oregon Army National Guard that has helicopters.
Okay, so Air National Guard, probably we don't have any need for jets, obviously. So it's the helicopter base that provides that. We did learn something interesting with the photograph you saw on the sister recovery of that hiker's body. The only way to get that hiker out effectively was by helicopter. And the military apparently has a big issue with transporting deceased persons on their helicopter. So we had to work all the way up through the rank of general to get authorization and permission for that helicopter they were fine transporting our teams in and out. But when we requested a transportation of the body of the deceased, they said, no, we don't do that. So we had to talk to the general, which took some time. But our staff was diligent, and the military was gracious, and it all worked out. So all those relationships are in place and have been for years, and we will continue to rely on them. It wasn't, I don't know, directly mentioned, but in that SAR program, we still only have 2 FTE. All of that service is volunteer-based. A couple hundred volunteers that live and breathe that.
Thank you so much.
Okay, we have time for one more question. Sean?
I have on the card just some follow-up questions about contracting. Did I get that to you?
Yeah. Go ahead.
I can put mine in
Okay. Any other questions? Hopefully not. We're out of time. Thank you.
Thank you very much.
Thank you, group. And to the committee, there is a method in my madness to try to move things along so we can take an occasional 5-minute break. So I'd appreciate No? Keep going. Eugene Police Department, and the system does work.
Even a blind squirrel finds an acorn now and
That's
again.
right.
This, by the way, is the highlight of the presentation, all the pretty colors and the waves. Rebecca deserves credit for that. Okay, so up in the top left corner, you have our mission, which is basically to promote public safety by prosecuting the guilty and protecting the innocent, solving the death investigations, and managing the family law piece. The balance of those three categories will sort of address in order. This shows how our FTE are distributed across the divisions. The lion's share is in the adult prosecution. We do very little juvenile delinquency stuff, but it's enough to keep it. Really, if we were doing it aggressively and if we had more of the workload and less was done by the folks at Youth Services, it would be more than enough to keep one deputy DA busy full time. But the Youth Services folks help out a lot in that regard. Victim Services has 5.6 FTE. The next block down is what used to be Kids First, and as many of you know, this is the last year that Kids First is going to be part of the county. They're moving out on their own as a fully independent nonprofit. And then we have the two deputy medical examiners, and those of you who've been part of this process in the past know that we respond to about 1,000 or 1,100 unattended deaths a year. They're very, very busy, and so our staff there is augmented by part-time folks. This shows how our FTE numbers have declined since the 2008-9 year. The big drop that you see this year is just the loss of the 5 FTE out of Kids First. This shows the rough proportions of the felony work that we're not filing due to lack of resources. This is the same picture, actually, that you saw last year. The number is slightly lower. We were closer to, we were over 1,600, almost 1,700 the last time. And we actually, we went up a blip there. It got worse for a period of time. But now it's much improved, which is good news. We're making a little progress for a number of reasons. As you know, in prior years, we've spent a fair amount of time projecting what the expected losses, financial losses, are as a result of our declining share of the state's community corrections pie. And for the first time, we have some pretty concrete data on what that cost looks like. you see in a number of the projections, and this applies to both the community corrections funding that comes every year and to the justice funds under 3194. We don't know how much money the legislature is going to set aside in 3194 for this coming year, but it's grant competitive with the maximum proportion based on whatever your county's proportion of the community corrections money is. So when we drop from 9.37%, which is where we were during the last sentence, down to 8.2%, 2.6%, it's a net reduction of 12% in community corrections revenue. So assuming there's $220 million in the pot, that means we go from about $10.3 million to about $9 million a year in community corrections money. It's a big hit. It's worse when you consider the impact on the 3194 money. Per year, yeah. This isn't these aren't biennium.
No, so your math was wrong. It was biennium.
Yeah, I'm sorry. It's reported by biennium, but because our budgets are annual budgets, I always try to annualize the numbers.
Yesterday in the TSDC meeting, everything was biennium. So
right.
That's why I was like, well, I thought it was $20 million. So
yeah, no, you're right. You're right. It works out to, depending on how much money is put in the 3194 pool, we're losing about $1.3 and $1.5 million a year as a result of not doing the prosecution primarily over the last 3 or 4 years. This is the JRI funding numbers. Is this a pointer? Oh, it is. Okay, so there you go. This is the new number at 8.26%. We're assuming that that's how the money is going to be apportioned. So if the number is at $58 million and it's not going to be, it sounds like the best case scenario is $53 million because that's the actual projected savings from our reduction in prison use. $20 million is the number that was in the Joint Chair budget. So I think the best case scenario might be closer to $40 million. So we're looking at maybe potentially that number for biennium. This shows you what the Oregon prison forecasts. For those of you who haven't seen it, the green line is what the forecast was projected to be back in 2013 when they were looking forward saying, if no changes are made in how we use our prison space, that's how much prison we're going to need. And we were going to need to open 2 prisons basically by the end of that chart, which was a tremendous amount of money. And the money that the state is saving is the operational costs, that's immediate, but also the foregone construction costs of the 2 prisons, the second of which would have been the Junction City facility. If you look at the purple line there, it shows the enrolled estimates, the estimates of the prison forecast as the bill was enrolled. And then you can see how we're doing with the black line. So the black line shows that we're actually trending down about where the October 2014 forecast expected us to be. So that's where the $53 million in biennial savings, I wish the state budgeted in our world. I want to point out that Lane County's prison use has actually increased a little bit, and there are things that influence our workload and our prison use that have nothing to do with the focus of 3194. 3194 looks at those people that we can divert from prison. But there's a whole population of offenders, murderers and sex offenders primarily, and people who commit acts of serious violence who are going to go to prison no matter what. And if you look here, you see that in the person crimes, these are assault, manslaughter, murder. We're using much more prison than we did the year before. That's just the normal ebb and flow and the kinds of cases we get. There's really nothing we can do to avoid that. Those people are going to go to prison. Same thing with the sex cases. Same thing to a large extent with this category that's described as other. There are many in this category of other that are violent crimes, compelling prostitution, racketeering, manufacturing of an explosive device. They're very serious crimes. They're not minor property offenses. But if you look at the property crimes, you can see that there's been a substantial decline in our use of prison space for those folks, which is, and same thing, if you look over here on the far end, the marijuana cases, we don't send hardly anybody to prison on marijuana, no matter the weight, which is, shouldn't be a surprise. This sort of breaks this down into how first sentences and second sentences go, and this is important only in terms of understanding how it is that we divert people out of prison. When you have somebody who merits a long prison sentence, it's because they've done a series of important, significant crimes. And the way they get diverted from prison is to put them on what's called the downward dispositional departure. You take them from the prison track and you put them on probation with intensive services. And Donovan's going to talk a little bit more about that when he talks about parole and probation. The thing is that although they don't go to prison initially, if they fail to perform on probation, then they do end up going to prison. And so your total use of prison beds is a function of how many people you send initially and how many people you put on probation and subsequently screw up because they end up going to prison too. So the next slide shows the prison intakes following probation revocations. These are people basically who got a break. And the people who are having the most dramatic impact here are the people who are on these downward dispositional departures. And one of the things that I'm going to talk about in just a moment is one of the new programs which takes a larger share of those people who are looking at very long prison sentences and primarily for repeat property offenses and puts them into Donovan's hands locally to save prison space. But you can see now the revocation number or the prison use on second sentences has actually gone up in Lane County because these are more people were put on probation in the first place. This shows that generally speaking, our property and ID theft is typically considered a property offense. Our prison use is down, but we've had this huge impact from sex offenders that we've processed over the last year. I don't know why, but there have been a ton of sex cases coming into our office over the last more than a year, actually. LOS is length of sentence or length of stay in prison, and here's where you see pretty dramatic impact. Frankly, I can't explain this number, the driving while suspended number, but identity theft and other property crimes, our length of stay has dropped. So, turning the page, the question is, what are we going to do? What do the new programs look like? The first big one is duplicating Marion County's 416 program. This was sort of the brainchild of Doug Harkleroad and Ross Shepard, who many of you know was the former director of the Public Defender's Office. It was a collaborative effort, and the idea was to create a program that had provided more services, much more intensive services for people who were going to prison, and they're all medium, high risk to high risk offenders, people who have a very high risk of recidivism, and putting them in the local community with lots of services to save prison costs. And in theory, to give these folks a greater chance of being successful in life. Marion County, we actually hoped to participate in that, but our staffing in parole and probation has been so chronically low, we haven't been able to do it. But with 3194 money coming on board and some other changes, including, frankly, our sharp drop in offenders under supervision, it looks like we're going to be able to participate. So in Marion County, the recidivism rate has been running around 15% a year. Obviously, continuing in this program depends on 3194 being funded, and if it doesn't happen, we're not going to be able to maintain it. The second piece is a community prosecution grant. This is a little bit more tenuous, but the idea here is to dip into that pool of cases that we haven't been able to file, mostly property and drug offenses, as you saw in that graph, and put them into a community diversion program with mediation services. I can't remember them, but it's not Oh, yes, thank you. Center for Dialogue and Resolution used to be CMS, Tip Coker. And the idea is, frankly, this is a diversion program with not much in the way of teeth, but these are cases that we wouldn't be doing anything with otherwise. And the good news, there are several good pieces. One is that we get a restitution order up front for anybody who wishes to participate, so the victim can be made whole if the offender ever comes into money through inheritance or a job or whatever. And the other thing is that there's at least a shot. The data suggests that community mediation can be very effective. It's a chance for, we only do this on property offenses with a local victim as opposed to a big corporate victim. And the idea is that the victim can sit across the table from the offender, if they're willing to participate, and say, this is the impact you had on my life. And when offenders see that they've done harm, those that have a conscience feel badly about it, and they want to find a way to avoid doing that again. So we don't have much skin in this game, because if we didn't use this program, we'd be doing nothing at all. So at least we're getting the restitution schedule in the bank, and then hoping that something good comes of the program. Those of you who were part of this last year may remember this. This is just sort of a parting thought, a couple of slides to ponder. Most people think that property crime goes up sharply when there's a recession, but actually crime tends to go down when we have a recession. And so that's what we've seen over the last two recessions in Lane County. And when the economy has recovered, we've seen a significant increase in crime. So I mentioned that. There are lots of theories as to why that might be. And this isn't to say that there aren't anecdotal situations where some guy goes and robs the pharmacy or robs the bank because his family is in extreme financial hardship. Obviously that happens. But over tens of thousands of cases, it looks like this. And the reason I mention this here is because our economy is improving, so we're likely to see more work as our resources are really pinched here, because we're not directly affected by, there's a lag between when the economy improves and we see any improvement in revenue. The other thing is, and this may be even more important in terms of short-term budget considerations, we've had this significant drop in community corrections revenue, and we will see the smaller share of the 3194 revenue, whatever it is, because our share of the overall pie has declined. It's declined much less than we thought it would, primarily because Multnomah County, which is the biggest county and has overwhelmingly superior crime volume, they've had a sharp decrease, probably in part because of what's been going on with the economy. If Multnomah County rebounds, they're going to have the resources to prosecute and manage that crime. So that's likely to have a larger adverse impact on our community corrections revenue than our inability to prosecute has. If you look at our overall decline in the number of offenders being supervised, it's much larger than the 12% reduction that you see between 9.3 and 8.2. We've been buffered substantially by other counties benefiting from a decrease in crime rates. I hope that makes sense.
So that crime rate decrease is universal. It's not just peculiar to Lane County.
Well, yeah, Lane County hasn't really experienced the decrease to the extent that Multnomah County has, and it has had a less significant impact on the number of cases filed, because the number of cases we file is a function of the number of employees we have. We don't have enough people to process. It's the same thing with, if you look at Lane County police officer arrest rates. Lane County arrest officers on average arrest at several times the state rate because they're at capacity, and it's a target-rich environment. There's so many people with warrants out there that they just encounter them and hook them immediately. They can turn lots of arrests on a shift, right? It's like that for our prosecutors. Our limiting number in the prosecutions is just our staff. It's not the work coming in the door. But in other counties, it's the work coming in the door. So you see that the benefit, the crime rate benefit from a declining economy in Portland.
Anything else?
No, that's it.
got a couple minutes for questions.
So, one quick question. There's a bill in the legislature about grand jury recording. Can you talk about the fiscal impact to your department if we have to go to grand jury recording and some of the issues around that?
Boy, there are a lot of issues, and I'm happy to send a sort of a distillation of the primary concerns. The biggest concern, other than the biggest concern really is the adverse impact on victims, particularly vulnerable victims. It means that elderly people and young children are going to have to come in and testify in grand jury, and they're going to be recorded. And frankly, given our experience with victims, they're terrified by the idea. Gang cases, it's a terrible idea. So there are ways to do it properly. In fact, the Oregon District Attorneys Association has a proposed bill for grand jury reporting that's a little bit closer to the federal model, which would allow hearsay to come in, for example, as they do in the federal system. And then, although there's recordation, there are restrictions concerning who gets access to the information, so it's not just immediately published for everybody. It retains the integrity of the process. In terms of the fiscal impact, somebody is going to have to manage all those recordings. And we've been pushing very hard, saying if you're going to do it this way, we don't want the data storage. We can't afford to put in the good recording systems like duplicate the courtroom FTR system. And frankly, we don't want it to be the county's responsibility because any failure in that system is going to be attributed to us. We're saying this is a court process. The court should be responsible for the recording system. But if we're going to do this, let's do it right. This is an Oregon Criminal Defense Lawyers Association bill. It was written by Gail Myers, for those of you who aren't familiar with that. She's the OCDLA lobbyist.
Could you tell us a little more about the transition with Kids First? I'm familiar with the program and how it's structured, and was that a long-term plan for the program to become independent, and what the relationship with the office will be moving forward? How much was fiscally driven, and what their financial maturity?
Sure. So Kids First was first created in 94 as the Child Advocacy Center, and shortly thereafter there were discussions about when it should move out on its own. It's been a very good relationship with the DA's office. There are many benefits associated with being a part of the DA's office. But as you saw on that slide, our cost of the operation hasn't declined. And that's because Kids First is largely grant funded, and the grant money is much harder to get when people see us as being part of the county. They don't like the grant reviewers don't like county overhead. And folks in the community, when they think that we're associated with government, they don't want to give, philanthropically. So in terms of the continuing relationship, it's going to be very good. We've still agreed to support. Obviously, we're going to staff the cases and work with them, but we're also going to help with grant reporting because we have the data for them in terms of the number of cases and dispositions.
So you'll be housed at the campus and...
That's what it looks like now. I don't know. I mean, the county's been great in terms of supporting the separation, and I think we'll be able to work something out.
If I can just add to that, House Bill 3194 sets aside 10% of this biennium's funding for victim services, but only for nonprofits. It can't go to a government agency, so they wouldn't be eligible for the 3194 victim services funding if they remain within the DA's office.
Okay, one last question, Sharon.
I'm not familiar with House Bill 3194. Is it independent of the Community Corrections Act, or are they tied together?
It's independent. The long story short version is the legislature is invested in trying to reduce prison costs. And so the question is, how do you reduce prison costs without having an adverse public safety impact in the communities? And so this was something of an experiment. The idea is if you, DAs and partners, find a way to reduce the rate of incarceration in prisons, then we will give you all the money that you saved via competitive grant process for the local communities. And so the promise was made. It was a collaborative program that the governor's office and the DAs and several legislators worked out. Actually, chiefs and sheriffs helped. But so now we've saved the money. to the tune of $53 million, and they're proposing to give us back $20 million.
Okay.
So there's some grumpiness. But the connection between this and Community Corrections Act is that they're using the Community Corrections Act allocation formula. So if we have 9% of the supervised felons, then we're eligible through the competitive process to get up to 9% of the 20 million or 40 million or 53, whatever they fund. So that's the reason that the community corrections math is hurting us twice.
Thank you. That provides a lot of clarity. I appreciate it.
Sure.
One more very quick question. So is any of the funds, competitive funds that we're hoping to receive from House Bill 3194, is that included in this budget?
I'm getting a mixed bag. Becca, you want to?
Yeah. Some, the two JRI grants, the 416 and the community prosecution, those both have some funding included in the 15-16 budget. We're not sure about year 2 or how much the funding will be, so we've only got a few months worth of funding in there for the amount that we know.
Thank you.
Okay, thank you very much, Alex.
Thank you all.
Mr. Dunn?
Well, sir.
So I did come with some handouts. So some of the presentations, some of the slides actually refer to this first handout. Good afternoon. My name is Donovan Dumeyer. I'm with Lane County Parole and Probation. I'm the manager with Parole and Probation. I've been with the county now since October of 2014, so about a year and a half. And since I've arrived, we have been... All my papers. I thought
Those are all my papers. Thank you.
And since I've arrived, we've been extremely busy. So, Parole and Probation, really exciting times right now. What I'm hoping to cover today with you a bit is who we are, kind of an overview of the services that we provide, a revenue, kind of where our income, where our money comes from. Working on big initiatives right now. I'd like to cover some recent successes, some significant constraints, and then if we have time, maybe take an opportunity to review some best practices. Our mission within Parole and Probation is to improve the quality of life in Lane County by effectively responding to risk, need, and promoting positive change. You'll take a look at the 1995, we were with Health and Human Services. In 2008, we were with the Sheriff's Office. And recently, in 2013, we were with County Administration, where we're currently at. We've had an enormous amount of transition over the last many years. And with that, we've kind of taken on some different views and perspectives, and I think what was really important when I arrived here in Lane County was to really talk about what it is that Parole and Probation is. Who are we? What do we stand for? What's our brand? And so one of the first things we really did is we worked as a team. It wasn't me coming in saying, hey, we got this new idea, we're going to adhere to best practices and carry forth. It really was an opportunity to educate staff, talk about what best practices really are, and then as a team develop our vision, our mission, our values statement. What do we value as a profession? And then I think more important, our expectations. And so I've provided a copy of that here for you today, which I'll pass out.
We try really hard to be accessible and working with the clientele. We have offices located at the main CCC, so we're upstairs of the Community Corrections Center, and that's where we're currently at. That's where most of our POs are stationed. But we also have satellite offices throughout the community. So we have Hacksaw locations. We have 2 POs located at the sponsors. We have a PO at the West University Public Safety Building. We have a PO out in Bonita, Junction City, Cottage Grove, Oak Ridge, and Florence. So we really do try to remove barriers for the folks that we're charged to supervise. Staff, we really are blessed at Parole and Probation to have really just good people. Currently, we have 29 POs. 1 manager, 4 supervisors, 2 corrections techs, 6 support staff, and most recently, I'm pleased, an accounting analyst to help out. One of the things that we'll talk about here in a bit is some of the vacancies we have. We have 5.8 vacancies currently. The good news is we have 2 new hires set to start on the 18th, so that's some relief. And then we have a 3rd in background. We just finished up with interviews where we have a couple moving on to second interviews. So we're making a dent there. Parole and Probation, we are very lean. There's not a lot of management. We have 4 supervisors that oversee an entire team. So we're really fairly effective as far as being able to work with our staff and all really do our part. So safety throughout our community in our county. One of the things we've really worked hard to do in the last year and a half is really adhering to best practices. So what does the research tell us? And how do we implement that into our strategies and community supervision? One of the things we know, and last year when I reported here, we were really focusing on assessment, really identifying the risk, need, and barriers of the folks that we're charged to supervise. When I first reported here, we had over 1,000 assessments, risk need assessments that were due or overdue. And these assessments are typically done when folks are released from prison. So essentially, we just weren't doing a very good job of conducting our assessments. In April of last year, I reported that we had maintain and become current with those assessments, and we've maintained current in our assessments, which really has allowed us to propel in some of the things that I'll talk about here in a few moments. From our assessments, it really gives us the ability to prioritize risk need, identifying the need factors of the folks that we're charged to supervise, and developing plans, quality case plans, to really be deliberate and specific with our actions. We know that certain risk factors carry a greater impact of reducing recidivism than other risk factors. We have specialized supervision strategies, so we have folks that specialize in sex offender supervision, domestic violence supervision, working with mentally ill folks, intensive supervision, gang task force, and then soon we're really looking at enhancing our mental health caseload and our gender specific. We know that our female population carries different risk need factors than our male population, and for a long time we've been actually kind of working in those 2 populations the same. So there's some new research out, new assessments that we're going to be using and implementing with our female population. One thing that we are striving to do is a balanced approach. So accountability and rehabilitation, those 2 things are instrumental working together to produce and maximize our ability to navigate change with the folks that we're charged to supervise. Swift responses to violations, crucial. Individualized responses, the one-size-fits-all mold that we put folks into in the past, we have to really move away from that philosophy. People are individuals. This is a social science, and we have to work with folks accordingly. Applying dosage, really targeting our highest risk, and really putting the amount of time and the programming and the efforts into the folks that pose the highest risk. Being responsive to victims and continuous quality improvement, so improving everything that we do. Improving the health of our communities. We do this through, in the past, Parole and Probation has been primarily a broker of services. So we make referrals to motivation groups, cognitive behavioral therapy, mentors, parenting classes, domestic violence, sex offender treatment, substance abuse treatment, education, employment, special services, mental health services, and healthy housing. What we're really trying to do within Pro and Probation is actually be a part of the change process. So what we do with our clientele really does drive it, cognitive-based interventions, and really does strive to be part of the dosage rather than just kind of a check-in. So when we're meeting with folks, we're looking and talking about risk need factors and really using best practices to drive those discussions to actually have an impact and be a part of the overall dosage required to impact change. Networks and partnerships. We work closely with our team partners. One of the things that we really strive to do is develop a professional alliance with our clientele, building a rapport. We know that is crucial in navigating change, lasting change with the folks that we're charged to oversee. We've really worked hard to bridge and forge relationships with the Sheriff's Office sponsors, Hacksaw, our treatment providers, and really taking on really kind of a quality perspective with programming. Victim services, law enforcement partners, judicial partners, internal collaborations, best practices, committees within our office, Department of Corrections, and then we've really strived to really become part of the statewide committees, so Sex Offender Supervision Network, Family Violence Supervision Network, OACCD, which is Community Correction Directors, FOG, Field Automated User Group, and one of the most impressive groups right now statewide is the Risk Assessment Work Group. And this is a group that's really tasked to oversee best practices in the state as a whole. So it really gets us an opportunity, really provides us with an opportunity to be on the forefront of the research. The revenue, so where does our money come from? At this point, we receive no general fund. The primary bulk of Pro and Probation's funds really stem around the Community Corrections Act, CCA dollars, and that counts for about 76% of our income. Supervision fees, we have really been innovative in collecting those. We've prepared online options and really become current with the technology to really try to strike at this, but that accounts for about 10% of our revenue. Justice reinvestment, grants, Measure 57, 1%, 3%. So the bulk really is the Community Corrections Act and funds there. Big initiatives, partnerships. One of the most exciting partnerships and initiatives that we have going on right now is the Oaks Project. And Pro and Probation has partnered with Hacksaw and sponsors to really support and get behind a 50 to 60 unit apartment complex used for long-term affordable permanent housing. This is crucial. Currently, Sponsors does a phenomenal job of working with our clientele out of prison, navigating change, getting them into treatment, really striking at beliefs. And right at about that point, 3 months into supervision, we have to transition them. And at this point, we don't have a lot of options. And so what this does here is this really provides a great option to transition folks who are serious about change into a longer-term housing option. Within this complex, we're going to have 2 POs stationed, and like the intensive sponsors program, we will have programming available within this. So it won't be as intense as the transition intensive program at Roosevelt Crossing, but it will be programming available here as well for sustained change for folks that are interested in that. So this is one of the biggest projects that we're looking at. And so this is exciting for us, and it really does work with folks, veterans, seniors, people with disabilities, and folks that really struggle. Our sex offender population, person-to-person offenses for housing. This will be one of those options. Another big initiative, and Alex talked about it just recently, Senate Bill 416, which is a pilot that we're looking at. And 416, as Alex mentioned, didn't come to fruition, but the model is very much alive in Marion County. I won't go into a lot of detail, but really what this does is it gives us the ability, working with the DA's office, to develop pre-sentence assessment and really utilizes assessment to kind of drive decisions as to whether or not people go to prison or whether or not they're amenable or there's an opportunity for them on supervision. As Alex mentioned, it really does focus on a target population, and our target population is moderate to high. And what I'm really excited about is the strong collaboration, the opportunity for probation officers to work with the district attorney's office and really start to kind of talk about some of the things that we do in best practices in case planning. One of the things that we're looking at is swift interventions, and not only that, but swift movement into programming. And so this is one of the biggest pieces that Alex didn't mention is we're looking at a randomized control trial, which is really the gold standard of assessment. And so this is one of the pieces here, and we're actually being considered with Marion County in this to develop this data. But what we're really going to do is figure out whether or not this is effective, what parts of this are effective, and really get some strong outcomes as to whether or not this is an effective model or an effective approach. So it's a really exciting opportunity for us. One of the things that we talked about last year, and this has been something that I've been working on for well over a year, we have at Intake, we perform a battery of risk, need, and responsivity assessments. And so one of the things that we're really striving to accomplish, and through a local JRI, we were able to achieve pre-treatment and cognitive behavioral therapy right outside of Intake. So one of the things that we use cognitive behavioral therapy and motivation curriculum for is twofold. One, we use it to address motivation. Motivation is a key responsivity factor and a barrier that really enables us to promote the change that we would like to see. So addressing hearts and minds is something that's crucial in order to open folks up to the possibility of change. Motivation, attitudes and orientations. Attitudes and orientations is a top criminogenic risk factor. This is really, if we have somebody that has high attitudes and orientations, deficits, antisocial patterns, this is an area that we need to address first and foremost. And out of Intake, once we've conducted our risk needs assessments, people are referred automatically into motivation curriculum and then on to CBT. So this process is done very, very early to prepare people for treatment and to kind of shift those hearts and minds. We have sponsors in Emergence that are overseeing these two programs. And one of the unique, I think one of the biggest benefits, which was kind of an unforeseen benefit, is we've really had an opportunity to shape our contracts. Many of our contracts don't really include outcome measures. And so one of the things that we're hoping to see in this is, one, fidelity to the model. So if we're utilizing MRT and R&R and some of these different programs, we want to make sure that we're adhering to that. And anytime we deviate from programming, we diminish the effect, or we minimize the effect. Increases our overall ability to navigate change, and we get this really early in the process. The motivation curriculum right out of Intake is about 2.5 weeks. After that, we conduct an assessment and then make a referral to COG if need be. So this is one of the biggest, I think, recent successes that we've implemented. So this is pretty exciting. Recent successes. Another recent success. We've worked hard. Last year when I was here, we talked about our moving forward with assessment. really getting the idea of risk, need, and responsivity with the folks that we're charged to oversee. Case planning is really the second phase of that, using those assessments and really generating quality case plans. And a lot of benefit. One, currently case plans are required for OAR, per law. But what case plans do is it really identifies role clarification with the client and the PO, client buy-in, collaboration. These case plans are meant to be worked with the PO. They're individualized, bridging skills, incorporating dosage, prioritizing risk, and they're meant to be focused and deliberate. And they provide justification for what we do. So it's kind of the filter and the track that we're taking with a particular case. One of the things that I'm proud to say we've done, we've maintained our current assessments. In April of 2014, and then again in January, we've really put in a lot of training and a lot of time. We've encouraged skills practice. And at this point, what we're looking at doing is we've actually implemented case plans within the cases, demonstrating skills. One thing that tends to happen is we will implement something or a new strategy and there's no follow-up. What we're looking at doing is providing a review process and a feedback to really encourage. And this is a skill set that really working with the client is beneficial. But providing that feedback, coaching, and that follow-up to make sure that it's done with quality. Anytime we kind of implement something, it's only as good as the time and energy you put into it. We want to make sure that it's quality and that there is buy-in to this plan. Significant constraints. Talked about it a little bit. We're recruiting. We've been recruiting for some time. Currently, we're 5.8 to 7 officers down. We're looking at 5.8. We have 2 that are in background, so my hope is that they decide to stay here in Lane County with us. But if they move on, it's for a good reason, so we would support them in that. But one thing to bring new folks on, it's not a matter of just opening a recruitment and bringing them on. There's actually a year to really bring folks up to speed and proficient in training. So our field training program really lasts about a year. About 5-6 months into field training, we start to see some relief in caseload numbers. So that's a benefit. Another constraint that we have right now as a result of the officers and the recruiting is high caseload numbers. Our general supervision caseloads, if we were 7 officers down, we anticipate caseloads to reach 120. And so no matter how high those caseloads get, our philosophy will be the same. We will prioritize resources to the highest risk. One of the other things, and Alex touched on it a little bit as far as our constraints, high-risk clientele. Interesting enough, and we're second to Multnomah County, we lead the state in high-risk supervision, high-risk cases. So if you take a look at our numbers based on community supervision levels, we actually have 1,059 high-risk cases, 859 medium-risk cases, and 843 cases low-risk. And if you compare that to Clackamas County, Marion County, and Washington County, we well exceed them in high-risk cases. The difference between a high risk and a medium risk really boils down to the amount of risk-need factors that are involved. It's much more labor-intensive to supervise this population than this population, or even this population. These folks tend to have some of the highest risk.
Can you wrap
Yes, sir. Yes, sir. So, adhering to the risk principle, this is just basically saying that we prioritize resources to the highest risk. Intensive treatment for lower risk offenders can increase recidivism. People don't often think about that, but then the criminogenic risk need factors, as we talked about, attitudes and orientations, peers and companions, these are the top 2. History is the only thing that we can't change and we can't influence. So, in order, people often put substance abuse up here, but really, as we know, it's kind of a second or kind of an outcome of maybe some of these other factors. Dosage, 200 hours of dosage, evidence-based, cognitive-based intervention, so quality programming to see change in a high-risk behavior, and 100 hours to see change in a medium-risk behavior. So, a lot of information. We've been extremely busy within parole and probation over the last year and a half. We have a young team, energetic team. Half of our team has about less than 5 years of experience. Soon we're going to have 5 to 7 additional new POs, which will increase that. So we've got a lot of commitment in our office and a lot of opportunity to really shape competence, which is exciting for us. So,
thank you very much.
Parole and probation.
Thank you. We're out of time. If there's any questions, please use the card. Is there any other budget committee business?
Given the lateness of the hour, I would say no. I think the only comment that I would make, hopefully the community can appreciate, we can't have a lot in today, and we know that this was a big piece of the state and Hardin County Day. We really wanted the committee to understand the sort of holistic nature of all of these services, the impact of health and human services, the criminal justice system, parole and probation. I think that one of the successes of this budget that we're proposing is, despite all the challenges that we face and lack of funding in critical areas, we've been able to maintain the existing public safety services that we have today. That was a priority of the board, was to have further erosion. And as we look at future budgets, our goal, as we stabilize our financial resources, is going to be to make investments in areas, particularly, I would recommend police services for patrol, additional prosecution, and additional parole and probation resources. And if we can start chipping away, particularly those 1,500 viable felonies that we're not charging against, we can leverage additional state resources through Community Corrections Act funding, which will allow us to hire more parole and probation officers. So that, just to give some sort of wraparound to the end of the day here, that is our goal going forward, is as we stabilize to be able to make investments in those important areas.
Okay. Do you have anything? Okay. We're adjourned.
Steve, adequate number of probation officers.